It's my pleasure to start this exciting event, the first Baltic MedTech company, which is taking here place in Kaunas. You know that this event is organized by Invest in Lithuania, and it's happening under this bigger umbrella event, Switch, which I'm sure many of you have already the chance to visit. So I've learned already today that here in this auditorium we have a very diverse audience. We have representatives from businesses, we have government representatives, we have also people coming from academia, IT specialists, but I think what's the most important thing is that we have a lot of young, motivated people here, and that creates an extremely unique blend of knowledge that we can all share today. So we'll be having very many nice presentations today, but before that, we have a couple of welcoming speech, and we are very happy and honored to have here today the Minister of Economy of Lithuania, Mindaugas Sinkevičius, and I would like to invite him for a welcoming speech here.
Hello everyone, hello all. So welcoming speech, I think that it should be very short. I welcome you today with the creation of this kind of platform under a bigger event of Switch. We have a initiative by Invest Lithuania to have a platform for conversations, for discussions concerning MedTech. And there were some previously questions to the camera. So why Ministry of Economy is interested in this field? What does economy do to, how does it relate to economy to MedTech? And I think that relationship is really straightforward. We as a government tend to look at the fields that are not just the future, but that are actually now. And MedTech, a broader field of life sciences, both fintech, is one of the fields that we're really seeing us as front runners. Not just the ones that are lacking behind, but as front runners. And why do I think so? And why is here in Kaunas? I think that we all have, and we see, if we see it similarly, all the puzzle parts here. First of all, Kaunas region, despite that it's the second biggest region, it has the biggest amount of students, talents in a way, people to work with. It has wonderful universities, both health university and technology university. It has scientific valleys, that's also one of an issue. And there are all other elements that are here. And there are some good examples already. My core aim, and I think that the core aim of the government and both various institutions is just to foster, to make us front runners. Because I believe that we can do that. We're currently not, most probably, but we have to not just to see what's beneath us, but see the horizon. And the horizon, I think that we could be top countries in the context of European Union, maybe also globally. Next to it all, I think that's a wonderful opportunity to note that next year we'll be having Life Science Baltic, a huge event. Next year, we're celebrating 100 years anniversary, and the event partially dedicated to Life Science Baltic is a huge event, and I would like you all to be present there to see what happened in the upcoming year. And that's just another fact that really we're in a way dedicate our time, effort, and some finance to make these sectors visible. And that's all. Thank you. Have great conversations, both social networking and interesting speeches. Nice day.
Thank you very much, Minister. Now for a second welcome speech, I would like to invite Mr. Mantas Katinas, who is the head of Invest Lithuania, and this event would not have happened without the incentives of this organization. So please.
Thank you for the opportunity. So one more time, nice to see you. We've seen a couple of members already yesterday. We had a wonderful dinner, had a strong discussions at 2 o'clock in the night about blockchain, about genome, about platforms around. Nothing big is happening around. I think Invest Lithuania is by working with international corporations, recognized in areas where Lithuania can have a footprint in the future. And we believe that MedTech is one of the opportunities. And it doesn't matter what you think for now, we'll do that anyway in the next 10 years. So I think that in the 5 years, we'll prove that we're going to be serious in this area. So have a nice day. And thank you for our guests that they decided to come here and to help us to foster this community. So have a good day.
So we'll start now the part of the conference with the presentations, and we'll have many of them here today. And actually, I'm very honored and happy to give the first talk and present you Kaunas as a potential site for MedTech investments. I think it's a challenging task to do this in 15 minutes, but really, since it's my favorite city, I think it makes a really big commitment to do that. So, can we put on the slides? Okay, so personally, I'm a physician. I'm a gastroenterologist by training, but a lot of my activities are related to research. So I do a lot of translational research, and as a physician, I always try to look at what's going to be in our healthcare sector in 10 or 15 or 20 years later on. And but maybe you can still hear me, so we can go on. So I want you to take a quick look at the projection of expenditure on healthcare in United States, which is projected for the next 10 or 20 years. So in a short period of time, we might be spending as much as 30 or 40% of our GDP on healthcare. And this is, has been projected not only for US, but also for other Western countries. This, of course, puts huge pressure on societies as well as the governments to find this money. But of course, seeing these trends, Lithuania and Kaunas in particular wants to be a part of this GDP and take a considerable market share in that. So what has happened in Lithuania over the last 20 years, I think, is really incredible. If you look at the business doing rankings and competitiveness reports, we have really good positions which are constantly improving, and we have investment coming from all over. But really, what's probably most important, that Lithuania is one of the fastest GDP growing countries in Europe over the last 15 years, and that's something what probably shows that the general environment for doing businesses here is right. If we look at the life sciences sector, this is something that we are really proud of, and we can say that the over the last 7 years, the life sciences industry has more than doubled here in Lithuania, and with many pharmaceutical and chemistry products being exported every year in increasing numbers, this gives a really competitive edge for Lithuania as a country. Probably the best indication of the whole situation is the presence of international companies here in Lithuania. We have those really big names, including Thermo Fisher, Clarivate Analytics, Intermedics, and many, many others that you're very familiar. And I'm more than happy that many of these companies decided recently to settle up in Kaunas as well. So we'll be hearing today, later in the session, about what is needed to set up a MedTech hub in the area from Richard Kivel, but I think that Kaunas has many elements of what is really needed. So we have a really high-level education, research, and clinical practice activities which are integrated into one another, but we also have a right attitude and support from government and municipalities. Furthermore, there have been considerable improvements in infrastructure, and businesses are more and more coming here to the region. So, since you made your way to Kaunas, you are probably more than well aware that it's really easy to reach, and in terms of business perspectives, you can really see that Kaunas is very easily accessible, and it has excellent logistic routes through rail, through airports, through roads, and other opportunities. So as it was, as it was. Maybe you can, but you can hear me. Galite išjungti, aš manau, kad geriau. Okay. Anyhow, I think we can. We can go on, and as it was said already, Kaunas really adds a considerable amount of GDP in the region. It's the second area, and a lot of the products being produced here are exported. Next to it, you have a really good price to quality ratio, which is, I think, exceptional in the area with the talent that you have available here. So, as it was also mentioned today already, Kaunas is really one of the most student-centered cities in the Baltic Sea region. And every year we have around 30,000 students studying at different universities. Moreover, many of these students decide to continue research pathway, and over the last 10 years we have nearly 2,000 PhDs which have been accomplished here in this region. We have two universities, Kaunas Technology University and Lithuania University of Health Sciences, which work very closely related to the medtech and health tech sector. And if you look at the study programs which are provided by these universities, you can find virtually any type of specialist that you need for setting up your business here, starting from those very traditional specialties like medicine, odontology, veterinary medicine, but you also get these very fancy and new study programs on medical engineering, genetics, and most importantly, IT solutions. Hundreds of graduates in Kaunas every year who are trained to program and provide IT solutions for different kind of businesses. And when we talk about the healthcare sector, this is incredibly important. What's also really intriguing, and I want you to look at this number. So there's this year in Lithuanian University of Health Sciences, 18.5% of all students admitted to the first year are international students, and this is really provides absolutely different talent dimension in the area. And most of our students come from Israel, Sweden, and Spain, but the numbers of international students are steadily increasing in all universities in Kaunas. So this is that we're really proud, and it shows that our educational programs are very competitive in the region. What's also very important here that we have a very well structured and concentrated R&D infrastructure. You have universities, as I said. We have a big university hospital where you can check most of your solutions. And we have sciences and business valleys recently established here in Kaunas, and there are huge investments from the government to foster research and business doing processes recently. So if you look at the activities which are carried out by universities, there's a lot of going on in this translational research and linking the clinical part to the most novel solutions. And there are world famous researchers working in cardiology, neuroscience, oncology, and other areas. There's a lot of big data analysis now involved in the research which is being done in universities in Kaunas on microbiome, on genetics, and we'll be hearing today in the sessions a lot of how these things are becoming important in our healthcare management. And of course, the quality of the research which is done is represented by publications in top-level journals, including New England Journal, Lancet, and many others. In Lithuanian University of Health Sciences, we have 5 research institutes where you can basically find all the modern equipment which is currently needed to do fundamental as well as clinical research. You have animal facilities, you have wet labs where US businesses can come and look for potential employees and also test your solutions and get advice from the experienced scientists. And the Kaunas Technology University also have 8 research institutes, and they also, some of them work in the areas which are very linked to medtech. ultrasound, real-time computer systems, telematics, material sciences, chemistry, and many other technological sciences areas which are directly related to the medtech sector. As we have learned already over these 2 days, where companies who came here in Kaunas have directly contacted universities for seeking the employees, and they have been very happy and successful with their efforts. As I mentioned, has really gave a boost to the area is the investments by the government. There are science and business valleys, so-called. There are 5 of them in Lithuania, and 2 of them are based in Kaunas. So there's one valley is called Santaka, the other one is named Nemuna. So they provide a lot of R&D infrastructure needed for different type of research. So I have research activities here focusing on animals, on biotechnologies, food, on pharmaceuticals. There's also a National Innovation and Entrepreneurship Center at Kaunas Technology University, which tries to link different businesses and research solutions into one center. And there's also a place for startups, which is being really immensely used now in these science and business valleys. So there's a lot investment being done in that area, and really it has gave a really different competitive advantage for us here in the area. Just briefly to look at some exciting research, applied research projects which are being done. So there's a cancer sniffing project going on where you exhale air to electronic nose, and there are different mathematical models to evaluate whether the patient has certain cancer. There is an ongoing collaboration with IBM on the pathological voice development system, where just by the voice pattern the machine can detect whether you can have a cancer in your upper airways, and this is also very much advanced now. Of course, this guy here is his name is Professor Ragauskas. He has been named as one of the leading and most valuable researchers last year in the whole Europe. He has developed this intracranial pressure meter, which is very, very close to clinical application, and his invention received 10 million investments. So this is these kind of projects are really going on, and we are very proud of them. Of course, there are some other, not directly maybe to health-related inventions, but there's a food sniffer, electronic nose is being developed to test the freshness of meat, and etc. So it's difficult to put all of them, but this is just for you to get the sense of what's going on around here. What's also very important that there are a lot of clinical trials going on in Kaunas. In the university hospital in Kaunas clinics, there are at least 200 clinical trials running every year, and you can see the names of these famous pharma companies which entrust their products to be tested here in the patients, and they're absolutely happy, and then these numbers are increasing constantly. So this is the area which has become very big here in Kaunas, and we are very happy about this. So of course the best indicator of the Kaunas, that's a very good place for you to come and set up your business, is probably the success stories from recent investments. There's an American-based company, Hollister, which came to Kaunas recently, creating a lot of new jobs. There's also an Intermedics, and just by looking the reflections from the CEOs from these companies, you can have the impression that things are really going on in the right way here. So absolutely, if you look in the world map and you are looking for the next place where you can position your company, Kaunas is a very attractive site. I think that currently we are being discovered by many companies, many people, and the changes which have happened here over the last years are tremendous. So I want to finish off my short talk just by showing you this image. If you look outside, this looks quite nice. There's a lot of area. But in 2 years' time, it will be even nicer. So there's going to be a so-called Science Iceland. There's a National Center of Innovation of Lithuania, which will be built here in 2 years. The main aim of the center is to foster the curiosity of young people and to get acquainted with research and technologies early in their years, when they're in school. And I hope that this just really demonstrates the dedication of the city and region to even more invest in this area and attract more international partners to Kaunas. So with this image, I want to thank you, all of you, and if you have any questions, please ask. We agreed that after each session we'll have one or most 2 questions and leave the discussions next to the coffee tables in the coffee breaks, and there'll be 2 of them. But if you, of course, if you have a burning question, we are always ready to answer it. So thank you. Okay, if there are no questions, then I'll invite the next speaker. He's Sami Chamois, a person I'm very intrigued by his speech because I'm also doing research in genetics. So today he will be talking to us about the global perspectives of genomics and analysis, and he's holding a chief executive position in one of the companies which is working in this area. So we are very much excited to your talk, to hear it.
Okay, thank you. So, first of all, good afternoon. I know it's the session just after lunch. Many people are feeling sleepy. It's a dark room. So I hope one thing, if we can all stand up for a second, please. Okay. Let's just clap quickly, right? We need to get some energy. Otherwise, this room is going to be pretty dull. So let's go clap when I say 3. 1, 2, 3. Once more. 1, 2, 3. Fantastic. So have your seat. Now I think we've got some energy going. Look, I am delighted to be here. And I would like to thank Invest Lithuania and other colleagues for inviting us to share our perspective on what's happening in the world of genomics. It's a field I'm exceptionally excited by. And over the course of the next few minutes, I'd like to share some of that excitement on why we think genomics is going to change the way healthcare is going to be delivered. And what I'm exceptionally excited by is that there's, in the audience, and otherwise Switch is an event for young people. When you guys look back, in 10, 20 years' time, you look at me and you look at us and say, you guys were so medieval in the way you delivered healthcare. You poked people, you took out the wrong organs, you gave us poisonous chemicals in some ways, which may not have killed you but didn't necessarily cure you, because there are all these possibilities which are opening up with some of the research which is happening at the Kaunas universities and other regions of the world. And I just want you to imagine for a second a world where the day you're born, you're going to have your sequence. That sequence will tell you the risks that you're going to be associated with, because the question will be, how do you live longer and how do you live healthier so that towards the end of your life you have the same quality of life as you have in the beginning and the middle. And if you do fall sick, we know exactly how to treat you. We know exactly what the treatment plan is. We know how to make drugs which are specific to you. And that's the possibility that we're going to live in. So if I go into this, and slides never can capture the essence of the excitement. But who are we? So what we are doing is we are solving a problem which is around the lack of genomic data diversity. So if you look back at right now, 60% of the world's population contributes less than 5% of genomic data. Now, why is that important? It's important because science is done on empirical evidence and data. And what we know about populations is that every population is different. I'm different from the individual next to me. But more than that, if we don't have the right information, we can make some wrong insights and wrong conclusions, which leads to unintended consequences. So this is a site of where we are based. I'm based there at the Welcome Genome Campus, which is the site of the original Human Genome Project. Very fortunate to to be co-located with the Sanger Institute and the European Bioinformatics Institute. And just as you were talking about the talent, there are 2,600 people who have focused on genomics and who are some of the world's leading experts that we can draw upon. And so again, the excitement around coming to Lithuania is this is all about people. It's all about the talent pool which will come into play, because the kind of insights we need to create will have to be created. Some of those exist, but those are all starting points. So that's something which is exciting. In addition to that, we are present in Boston, Singapore, and India. What we're looking at is the first phase is about building the data foundation, because once we have that insight about the human being, about what it means, we can solve a whole bunch of interesting problems. We are partnering with a whole bunch of leading institutions in genomics and companies, and we work with, either on the therapeutic end with the pharma or the biotech companies, with academics around the trials and research which is being done, as well as the government. So the three trends I want you to think about is, the first is there's a macro trend around disrupting healthcare, right? So we talk about genomics, AI, very exciting. These are technologies which all feed into it. The second is the economic and demographic shift in the way that different populations are growing, what's happening from an economic perspective. The third thing, which we find very exciting when we look at the areas we're operating in, is mobile internet. I was told yesterday that Lithuania has probably one of the fastest mobile internet connections in the world. Fantastic. But that all feeds in, because even if you go to to Africa or India or LATAM, in rural parts of India, people will always have a mobile phone, and there's some connectivity which exists. And the question is, we benefit from that trend, so how do we make that work? The second we have talked about a bit is the barrier to achieving the promise of precision medicine is the lack of genomic data diversity. And I'm going to start talking, in this, I'll focus on a clinical example on how we can change drug delivery, but I'll also touch upon other things which are happening with genomics. And the final thing is about, it's more about what we are doing, which is to build the longitudinal genomic data foundation with individual participants at the center. We're not talking patients, we're talking a human being at the center. And which is to be built in a very ethical, scalable, and digital manner, right? Just imagine this room with all the zeros and ones which has a genome, and that then you can work through to deliver insights. The person is at the center of it. And what we have to do is we have to understand, because this leads into some of the conversations I've had over the last couple of days, we have to understand the environmental factors. We have to understand the health and lifestyle factors. We have to understand the whole genome sequence or the whole exome sequence fact. You look at RNA, you get into transcriptome, you get into metabolome, you get into microbiome, something my colleague referred to. And then you have to look at the phenotype, which is what is the external manifestation of every element of it. And it's important because this data and this insight, captured not just once, but captured over a series of longitudinal period of time, is what's going to allow us to have a better understanding of how do we solve some of the biggest problems. So if you look at the way populations, for example, the health considerations, chronic diseases, which are typically genetically led, are some of the biggest challenges that are going to face from our era. We saw the other chart, which said almost 35% by 2040, 35% of health spend is going to be of GDP is going to be the health spend in the US. That's an incredible trend. Where do you find those resources? And the question is, unless we use technology to disrupt, we are not going to solve those problems, and we'll have the same issues that we hear about. So I want you to take away around this person is at the center of, and the data around them is going to be the center to solving the problem. Now, I don't know how many of you are familiar with genomics. Can I have a show of hands of how many people understand genomics or are familiar or heard of it? Fantastic. You're better than what I was before I started, right? I have some incredible people who I work with, so better than what. The thing is, the simplest way to think about genomics is, or the DNA is, think of it as the software code, right? And there are 3 billion base pairs which exist. So think of it as the length of the book. There are 23 pairs of chromosomes. One set comes from the mother, one set comes from the father, and we have 20,000 genes. So think of them as 23 subsections of this book of life, which have 20,000 chapters. What we are then trying to do, yes, these are mind-boggling numbers, right? 3 billion, 20,000. What we are trying to then do is do a Control F, which is, in the Microsoft Word, you do Control F. And what we are saying is, I'm looking for a particular phrase. Does that exist in the position that I'm looking for or not? And if not, what's the spelling error? If there's a spelling error, what does that mean in terms of the external manifestation, which is around either a disease is the color of the skin, is the color of our eyes, it's the hair, it's whatever it is. It could be that, or it could be, hey, does that mean that I could potentially have this particular disease? That's what we're trying to understand. Now, take another number. We understand less than 2% of the human genome. Less than 2%. But with that less than 2%, we have already managed to create insights around personalization of certain cancers, treatment. We are creating insights about, certain chronic diseases and everything else that's coming into play. And I want you to keep that in context of saying why this is an early science. The first human genome sequence took 13 years, 1990 to 2003. Took $2.7 billion, funded by the US and the UK government. Right now, I can do a human genome sequence, whole genome sequence, in 4 hours, cost me less than $1,000, or roughly $1,000, and it's going to come down. That's the transformation we have seen in 13 years. So it's an early stage. Think of it as internet in 1996. So I want you to be excited, and I want you to be devoted to saying, how can we transform? Because this is not only huge impact on human beings, but it's also huge opportunities for each one of you as you think about career choices. The bit which, can you move the, seems to have, yep, please. So what it's going to do, again, I wanted to give you a sense, it's going to create very different business models. And that's where innovation has to come into play. If you look at the two conditions, if you look at it as a binary in a very simplistic manner, we're either healthy or we are ill. And what happens is that we have early symptoms, we have diagnosis, we have treatment, we have post-treatment, we have lifelong management over time. And the human being goes from here to ill, diagnosis, you get back, or you don't, or you just maintain yourself along this path. And in each of these, there's a specific intervention which comes into play. Now, what happens is, if you could define, while you're still healthy, what the potential is, what the risks are, if you can define what's going to happen, it drives a very different business model, whether it's across prevention, whether it's across diagnostic, whether it's like therapeutics, whether it's like insurance. So let me give you an example what I mean by therapeutics. So in the future, instead of being, taking a pill every day because you're ill, suppose you have gene editing to address that fault. It's done once, it's sorted. You never have to take a pill. Suppose there's a condition with your heart. You insert a stem cell. The stem cell goes and fixes it. What does that mean? That means that the existing models of healthcare delivery changes completely. And it's precise, and it gets to it. And that's the future that we're moving towards. What does it mean from why did I put insurance? Because how do you factor that change in business model? Because you're not paying for a pill to be taken every day. You're paying for one-off intervention which changes the outcome completely. And you're already seeing certain drugs like Solvadi, which changes hepatitis C, where you have a 3-month course, and where it works, the liver is as good as new. That's the change. Yet it costs a lot of money. But the question is that better than taking a pill every day for the rest of your life? Imagine the human consequences. It's phenomenal. And that's what the promise is. You go into it. Now, I'm just going to talk to you on the clinical application. So if you look at drug creation, and this is, again, using genomics. So without biomarkers, I mean, in essence, these are just breakdown. But I want you to look at this figure here. Okay? There's an 8 and there's a 26. This is the for every molecule that goes into phase 1 trial for a drug development company or a pharma company, only 8% without a biomarker, with a selection biomarker, makes it through. So imagine the huge amount of investment that you have got to do. Put in 100 molecules through this, you have a failure rate of 92%. That's a failure rate. So only 8 make through. That's what the traditional drug delivery model is, a drug development model is. With selection biomarkers, what you're doing is you're changing the success outcome. So suddenly the success outcome is looking at something like more than 3.5 times better. That's the change. And again, we go back to it. We don't have unlimited resource. It doesn't matter whether you're a country, whether you're an organization, whether you're an individual. That's a much greater success rate. That's why when you look at the pharma companies and others of the world, or the biotechs, that's what they're excited by. That's what the regulator is excited by. And this is all the data is taken, the reference is all there. Mobile internet. So India, I remember, I used to be a consultant with a firm called McKinsey, long time back. And in the late 90s, we were looking at the trend around what the tele density in India was going to look like. India had a tele density at that point at 2 out of 100. Okay, 2 out of 100, landline. The 5-year plan projection was we'll get to 5 out of 100. What happened in the meanwhile was this telecom revolution. Mobiles came in, and right now, India has got internet users, 462 million users. Of that, 80% of those users are on mobile. 80%. And those users are more than what you have in the US, right? Both in terms of internet users as well as the usage on the mobile. That's the transformation and shift you're seeing from a demographic and an economic perspective. China, 731 million, 56% are using it on mobile. I'm sure Lithuania, I was looking for the statistics, I couldn't find it, so I'm sure my colleagues.
200% of those are mobile.
Fantastic. So you look at those numbers, it's staggering. So that's how things have to be delivered. So when I look at the stuff that we are doing, I'm traveling here, but I have a personal, I couldn't show. This holds my sequence, this app. I have something which looks at my drug response. I can actually put in the drug response and say, in the back end, the machine is looking at, as the knowledge gets, it's looking at that and saying, is this drug suitable or not? So I put in a drug and I say, hey, is this suitable or not? And it says, hey, if you're taking that drug, don't take it because I have a particular mutation which I'm sensitive to, which means I'm likely to have an adverse reaction. Now, this is one of the most common drugs given to someone of my age group who will have a certain, if I ever have hypertension or prospect of hypertension, this is what they'll refer without even checking. That has contraindications, which means the management challenge and the amount of money that you spend in correcting the wrong is actually going to be far more than otherwise. So my point is, this is the level that technologies and personalization will move. Now imagine you're in a strange country and you have something and you're about to be given you check it. So what have we done? We have converted something which is a one-off interaction, which is a sequence, into a multiple conversation because you're changing the dynamic. Your doctor doesn't need to know all the details because they're already overburdened. We have to respect the doctors. The doctors are central to everything that we do. We have to respect them because they do a phenomenal job. They don't have time for this. They get a lot of stress and strain from doing their job, plus you have patients, and all of us go in there and we add the stress to them because we've Googled something and said, hey, doctor, you're wrong because I Googled this and this is what it means, and the doctor has to do a good job of explaining. What you can do is you've just converted, say, when the doctor is giving something, you don't need to know everything. Big data and other things can sort things out because we know what the manifestations and other things come into play. And that is a trend. Now imagine that you can use that mobile internet anywhere in the world. We can capture samples. We can capture information. Whether you're in rural India, rural Africa, rural Lithuania, rural Latin, wherever it is, you can capture that information which creates a better insight about you. So that revolution is going to change and is changing. Now what that means is it leads to all sorts of applications. People love ancestry. People want to know where they come from. That's an application. People want to know what diseases they have a risk of. When you have better data, the data foundation, you can find that in a much better way. So there are all these things which happen and which will come into play. The bit which I think from a policy perspective, what we find, because we work with government and all, the reason they're excited is right now they're planning for spend happens on the basis of, hey, this is what my historic, chronic disease spend is. This is what my communicative disease spend is. Let me add the numbers and see what the budget looks like. Now imagine you were able to give a much more data rigorous view of saying, this is what the likely, instead of having that curve which just went up like that, you say, actually, this the split is going to be based on the genomics or the other data we have. This is what the split looks like. It allows for a much better resource allocation, which comes into play. So what I wanted to do today, it's a teaser talk rather than a detailed conversation, but it's in some ways wanted to tell you about the possibilities of what's happening. And I think we are all at the center of it. The technologies that are coming into place are going to play a massive role in terms of making it happen. So I'm just going to pause here. Of course, we were very fortunate that BBC did some profile of the work that we're doing in India. But I'm just going to stop here because, if nothing else, I hope I have conveyed the excitement about genomics. I hope I've conveyed the excitement about why you should be focused on seeing the paradigm shift which is happening and why you should invest time in it. And finally, I would like to agree with my previous speakers that having that right ecosystem is critical to it. And why I am in Lithuania is to explore that, because this is what is exciting, right? With people who are excited about science, people who want to commit themselves to making a contribution to changing the world and changing the way the healthcare is delivered. And then you have the supportive ecosystem, whether it's Invest Lithuania and the government and the advisors fitting in, and the other partners, whether they are the pharma companies or the other medtech companies, which fit into it, to make that happen. So I'm quite excited by seeing what I have seen today. And again, thank you for your time.
Thank you very much. Are there any questions? If not, yeah, please.
Thank you. So I have one simple question. In the last quote of the BBC you mentioned, so India had the opportunity to create something substantial because they had the data, enormous data. What if you can advise for smaller populations and smaller regions where they can focus to gather competitive advantages in future?
So if I understand your question, I think the question you're saying is one of the difference between a scale versus very specific, niche ethnicities or population where the scale doesn't exist to that level, right? So let me turn the question around. I think the question is more about opportunities of what can be done. So India, it's 20% of the world's population at 1.3 billion people. At this point of time, our assessment is it's less than 0.2% of genomic data, right? And when you look at the challenge is when you're in a health system like, let's say the UK, NHS will have people of different ethnicities who will walk in. You cannot deliver precision medicine if you don't understand the populations who walk in, right? So if you go back to the Lithuanian context, I think it's very important to understand the population. But more interestingly, it's about what is the broad opportunity that you can play at. And that broad opportunity comes back to your discussion around, going back, CONAS has an ecosystem. What is the investment that we need to make that not just regional, but a globally relevant player, right? So a simple example from banking example is derivatives. We were talking about it earlier. London became the center for derivatives, equities and debt and other things. New York still maintains a lead. London, over time, when it started in derivatives, everyone said, oh, it's an early fancy thing which started. London became one of the biggest center for derivatives. And that becomes a massive market which you're serving not just for the local needs, but for something beyond. And that becomes an inspiration, a story which you have to build up. So I would tend to think a very different context. We work in Singapore. Again, Singapore for us is great because they've supported us. We've been involved with the initiatives there. But it's again a launch pad for a much broader footprint across the region and across the world. So I would turn that around to say, you have a competitive advantage. Smart people, you're getting people, you're very cosmopolitan. You're getting people from all over the world, from the science centers, whether it's the Israels or the Indias or others of the world, who are coming in there, who are investing time in this. How do you use that to an advantage to create that hub? And genomics, I would say, is still early days in terms of establishing a critical and a competitive footprint and a sustainable advantage. So I would say that it's twofold. One is understanding and changing the health implications here, because it is much more efficient use of capital and resources. The second element is well, can you export some of that talent? Because you're already known for it, for the life sciences work that is being done. How do you change that? Does that answer your question? Any other questions, or think we are?
I think we have to go further. Thank you very much. Yeah.
Okay.
Thank you very much.
Thank you.
Again, applause for you. And, I want to introduce our next speaker, Mr. Philip Blanco, who is a general manager at DX6 Technology. He has been holding several very important positions in the healthcare and IT industries over the last decade. And today we are going to hear his talk entitled, How Can Medical Technology Reduce the Pressure on Healthcare Systems? I think this is a very important topic, and we are looking forward to hearing you. Please. Sure.
Thank you. Yeah, that's a great debate. So thank you for having me. Thank you to Switch organization for inviting me, and thank you to Invest in Lithuania for the great support that I received. I believe we all share the excitement of those young people, you know, that are there discovering new technologies, etc. This is a really great promise for that country. So today I'd like to touch upon, you know, the massive transformation that the healthcare industry, healthcare and life science industry is experiencing. And okay, that's me. Yeah, and I'd like as well to tell you a few words about you know, how DXC technology is responding to those challenges. So first of all, a few words about the DXC technology. So DXC technology is a newly formed company, but not a new one, because this is a combination for the merger that took place in April this calendar year of a Computer Sciences Corporation and the Enterprise Service branch of Hewlett-Packard. So we are forming you know, a big corporation that has more than 60 years of experience in delivering innovation to clients operating into 70 countries. And I would say the beauty of that company is that we are combining, I would say, the deep understanding, especially in healthcare, but also in other industries, with the domain expertise that we have accumulated, and also the software portfolio that we have developed, with the technology skills and capabilities from a company like Hewlett-Packard. So we are 170,000 employees around the globe, big numbers. But most importantly, you know, if we look into healthcare and our portfolio and compare to the other industries, you know, of course, banking is probably the most, the fastest growing industry for us in the IT services space. But you can see that healthcare for us is almost as big as banking. Another thing that is important in this chart, this is here, you know, you can see that even though we are an American company, we have big operations in Europe. You know, a bit less than 40% of our business is made in Europe. So definitively, our presence in Lithuania is really key to servicing our clients, especially in Europe, but also in the United States. And finally, you know, we are also a technology-driven company, and so we have developed innovation in what we call the next generation technologies. This all around the cloud, the cybersecurity, the big data, Internet of Things, mobility, etc. And you can see that almost 20% of our business now is made of those technologies, which is a big shift for us as well, moving from kind of traditional IT services provider into a next generation IT services provider. So, good. So what's going on in the healthcare and life sciences industry? And I believe the previous speaker touched upon that brilliantly. So number one, as the population is aging, you know, and this is due to the medical advances and technology advances that have been implemented in the last probably 50 years or so, there is a huge impact, and we'll see later in the presentation, on the way the healthcare services have to be provided. So number two, you know, this transformation is having an impact on the organization of the healthcare system itself that was very much hospital-centric until now. And with the obligation of taking care of those new patients with chronic diseases, there is an obligation of connecting all the different medical stakeholders around the patient, and most of them are outside of the hospital walls. And this is new, because if we look into the systems, especially in Europe, but also in the United States, they're very fragmented. There are silos where digital is present, but there is no communication between the GPs, the hospital, the municipality care, and the different medical stakeholders. And of course, as we have a lot of data that we can utilize as countries or healthcare systems, we can also use that data, leveraging big data capabilities in order to define patterns among the population and set, prevention campaigns, for instance. So informing the patients or the citizens about their conditions. And of course, chronic care is becoming a real burden for those healthcare organizations. So our objective is really to take those organizations into what we call digital health, which is about enabling more of personalized care, using predictive analytics, and using algorithms as well, or new technologies, in order to being able to improve health outcomes. So a few things that have been addressed, but those things. But for instance, 3D printers, we can do things in order to help burn victims, for instance, replacing the skin with those technologies. Telemedicine in most countries is becoming reality. There is no need for having personal interactions between the physician and the patient. It's true for routine interactions, but it's also true today for much more complex, consulting procedures. And then, you have this internet that is accessible at the fingertip. It's a most impressive, healthcare knowledge that has never been accessible to anyone. And of course, everyone, I'm doing this myself, when I have a consultation with a doctor, I'm immediately Googling up and checking. And what the previous speaker said is really true. It can be very stressing, actually. Yeah? If you check on Google and you put just your conditions, you can come up with very stressing, outcomes. But anyway, this is part of, the way we are addressing our healthcare journey today as patients. And of course, there are thousands of apps, that you can find for free for monitoring your glucose or blood pressure, etc. And personalized medicine, it has been touched upon earlier today, is really migrating from an era where we were treating people as being, one out of many in a certain medical condition, moving into a more personalized way of addressing those patients. Internet of Things. Definitively, Internet of Things is totally changing the industry. Apple Watch, all the medical devices or wearable devices that we use personally and that we will use in the future are totally changing the number of, the amount of information that we'll have around our patient journey. All the way through some kind of very disruptive, way for the future, or you could bring in a tattoo, your healthcare record, just scan it and get immediately the information. But anyway, we are all also using those technologies on a daily basis, and we are expecting the healthcare organizations to take advantage of this, leveraging that information, combining it with all the information that is already available in order to deliver greater outcomes. And then we have those medical advances like the genome sequencing that has been presented earlier, or the stem cells, or the nanotechnology that help, inject the right drug to the right cell when it comes to addressing cancer disease. And it has been said, but the cost of having a genome sequencing today We say $100, you said 1,000. But you know, compared to a few years ago, it's a big change, and it opens up, you know, tremendous promises for the future. Finally, not finally, but you know, another very important factor is this demographic trend, you know, in chronic condition incidence. You know, you can see here. This is in the U.S. This is U.S. population distribution by age. So you have the curve in year 2008, and you have the projection year 2030. If you look into 70 years old people, you can see that there were a bit less than 2 million in the United States in 2008. There will be almost 4 million in 2030. And if you look into the surface, you can see the number of people above 70 years old will double in 18 years from now. Same trend in the UK. This is between 2015 and 2035. But what does it mean, you know, from a healthcare system standpoint, from a cost of care standpoint? If you look into the population that is aged 70 years or more, and the multiple disorders that they are likely to have, like diabetes, cardiovascular diseases, COPD, etc., you can see that 70 years, you have 30% of the population, this is the United States, that has at least 3 conditions or more, 4 or 5. This has a tremendous impact on the cost of taking care of those people. Because when you have a person that is here, it costs you almost nothing. But when you have a person that is here, it costs you more than 30,000 US per person to treat that person. And actually, in the UK, they made a study which is that 7 out of every $10 or pounds of the total healthcare spend in the UK is attributed to caring for people with chronic conditions. So that means that less than 30% of the population accounts for 70% of the total spend. Let's just imagine that this 30% is no longer 30%, but in 2035, it's going to be 60%. It's not going to be any longer sustainable. It's totally impossible. Today, our systems are really under the economic burden of the chronic disease. So we have to do something about it as organizations, as country. Another very important thing is the increasing patient influence. You know, IDC, with its best practices in July 2015, said patients with low engagement levels incur cost from 8 to 21% more than patients who are not engaging actively. So that means that people that are informed about their situation, they can act upon it. They can stop smoking, they can eat better, they can do some physical exercise, etc. And this has a tremendous impact. Can you imagine 20% of the total healthcare spend? It can be really enormous. And finally, the promises of you know, this new model of care has no value if the data is not available anywhere at any time. So what has been touched upon earlier today around data mobility and accessibility of the data from anywhere is a key thing. Without that technology, without that in place, it's totally impossible to meet the promises of those new technologies. So here again, there's been a study by Economist Intelligence Unit, sponsored by CSC at this time, that says that healthcare organizations, they plan to increase by 60% the use of smartphones, you know, in their organizations, and by 33% the use of tablets. This is really critical for harnessing the promise of the value of those new technologies. A few words about DXC technology. So we have a strong experience in healthcare. And this is not only about improving care outcomes, as you can imagine, but this is also about managing the balance between the care outcomes and managing carefully the cost. Because this part of the equation will become really critical and will have a direct impact on the care outcomes. you have already treatments that are almost unaffordable because, you know, if you just increase the life expectancy with 3 months with a drug that costs 150,000 US, probably you could consider as a physician, as an healthcare organization, whether this is really worth it. But, you know, we're also talking about a human being and people. So that's really also an ethical debate. But anyway, the technologies will, of course, have an impact on improving the care outcomes, for instance, by reducing unnecessary variations in treatment. We have many examples where we can ensure that the patients are treated, I would say, equally, and then there is no waste in the way the treatment is. But also, you know, minimizing the number of duplicates in prescriptions, for instance, drug prescription or laboratory prescriptions, lab exams prescription is a good example. In most countries, you go to the GP, you have a lab exam, you go to a specialist, you have a second lab exam, and then you go to the hospital, you have a third one. So you are spending 3 times the same money for the same thing. So that's totally no longer sustainable. We are shifting from this, you know, very hospital-centric way of delivering care into a more appropriate way to taking care of those chronic diseases. For instance, you know, still today there are too many people that are going to the hospital, pretty expensive in some cases, to the emergency rooms for things that can be handled or problems that can be handled by municipality care, GP, nursing homes, etc. So this is no longer sustainable either. And then, of course, empowering the patients into those models is really key. As a company, we're also working with the life science corporations, pharmaceutical companies especially, but also medical devices company, in order to help them reduce the time to market for the therapies or the medical devices. Because here again, the long cycle of having to the market those new therapies or those new medical devices. But those could have a very strong impact, not only on the care outcomes, but also on the cost. And those should be, of course, on the market as soon as possible. So we're helping those organizations as well. And on the cost side, as we are kind of leveraging or optimizing the capability that are in place in the current organizations, we can free up money, bandwidth, capabilities in order to do more. Do more for more people if it's needed, or do more for the existing patients and delivering more value from the existing healthcare organizations. And of course, by doing this, we are also meeting the demand for chronic diseases, and we are helping those people to live in much better living conditions. We are also present in what we call the payment models, which is anything in relation to health insurance or public payer space. And here again, addressing all the inefficiencies that exist today, waste, in some cases fraud, will help free up money in order to invest further into the existing organizations. So what we are used to say is that we are supporting those healthcare organizations in achieving what we call the triple aim, which is improving patient experience of healthcare, improving health for the population, and lowering the cost per capita. So here is what DXC technology is doing in those different spaces. I would like, because I believe still, sorry. Yeah, I have a few minutes, 2 minutes. Just go to something that is, and of course we are working with strategic partners. We are working with the largest partners in the world, whether they are big or large IT companies or some more specialized like those here. So this is an example, but I will go straight. Okay, to this one. So in most cases, and this is yesterday I had a debate concerning what's taking place in Denmark, for instance, Capital Region and Region Zealand in Denmark. This is crazy. They are putting in place a mastodont, you know, that is kind of moonlight, you know, one size fits all. That is overly costly, not only from a cost of ownership standpoint, but also from a mobilization standpoint from the medical stakeholders in the region. And they've been doing this because in the last, let's say, 20 years, there was a big debate around, you know, how can we cope with, you know, making the communication between the different stakeholders much smoother, much more real time. And until now, we should say that we didn't have the technology to being able to address that issue properly. But today we have it because we have those technologies that help us using those API technologies, you know, that help us transform, you know, the way those IT solutions are delivered by, you know, working with an ecosystem of partners, like my colleague from the previous presentation or many others, ensuring that all the stakeholders, medical stakeholders, and there are hundreds, they have the right user experience, the right functionalities. So those are coming from apps, from you know, web applications, anything. But that can be a multitude of those applications, hundreds. In some cases, because we have put in place this at the Presbyterian Hospital in New York, we are integrating real-time 2,500 applications, operating real-time more than 10 million messages a day. So we have developed that platform that we can call Open Health Connect that is sitting on a big data and analytics platform as well. So then we can leverage that information that allows all the stakeholders in the medical journey to have the right user experience and the right solution. So those are small examples of things that we have been doing. For instance, in this case, this is in Spain, in the Galicia region, where we have developed a new generation of personalized citizen health and wellness portal that includes, you know, accessibility to all the medical services that are available in that region. Same in the UK with what we call Diabetes Digital Coach, West England, where we have put in place an Internet of Things platform that's enabling people with diabetes to better care of their diabetes. So I believe I'm finished now. I'm really glad that I had the opportunity to share those views with you, and I see that there are many others that are sharing the same perspective and the same view. So it's great to share those in this event. But also, as I said at the beginning, the excitement of the people that are all around and the young people, you know, it's really a great promise for the future. So I believe that in this country, you can make this happen. So thank you for your time, and of course, I'm happy to take any questions.
Thank you very much. Are there any questions? We have time probably for one question, not more, before the coffee break. If there are no questions from the audience, I just wanted to quickly ask you one thing. We were discussing this summit even before the start of this conference, that currently we are really trapped with the amount of data that is available for us. And as a clinician, I can tell that still there are very little solutions which make it meaningful decisions in the clinical practice. Do you think, what's your vision? What's the most important step to crack this bottleneck, to advance this big data analysis into the clinical practice?
It's really important, in my view, to have this platform that we had in the middle, because this is what is missing at the moment in most organizations. What you have is that you have partly those platforms that are based on all technologies, so there are limitations in relation to those technologies. So then you cannot harness the power of the big data platform, big data tools that you're using in your organizations. So you should think of, you know, putting in place the foundation first, because you need the foundation in order to put together all this information and being able to exploit it. That would be my advice. But because the big data technology that we have at our disposal at the moment is strong enough, good enough, in order to exploit this information. We have the capability to do so, but what we need is to have the information that is gathered in the proper manner.
Thank you very much. We'll now can go for a coffee break, and we'll restart in 15 minutes, so thank you.
good. I'll just dial it so it doesn't forget it.
Okay. Oh, yeah, dial, and I will have it too.
Yeah. All right, see you a little bit later.
See you after your speech.
Okay, yep. Yeah? Oh, shit. It is. Very good. Thank you. Well, we're getting people in.
Yeah.
All right, so let me just look at this really quick. Very brief, yeah. Very brief.
Okay, so we have to start the second section, and it's my pleasure to introduce our next speaker, Mr. Richard Kivel, who is currently a managing director at Greybella Capital. He has been serving as a chief executive officer for many years in different continents in healthcare-related businesses, and today he will share with us some examples of the countries where he helped to build ecosystems needed to boost medtech and other sectors. So, Richard, please.
Thank you very much. Wonderful. Thank you very much for the introduction, and it's really a privilege to be here, and just really dazzled by the talent of people in this room. You know, I've had the opportunity over many years, probably well over 15 years now, of working with different universities throughout the world, and most especially MIT. And MIT is sort of in a hub, Kendall Square, which is really a hub of innovation. Most people have always referred to it as sort of a very strong ecosystem. Happens to be it's a very good ecosystem in the area of medtech and biotech, but also in other areas as well. And over the years of working with the university, we began expanding on different projects. So we worked with different governments, including the Russian government on the Skolkovo project in Moscow. We worked with the Spanish government, Portuguese, and others. And right now I'm actually focused on a series of projects, primarily as an investor, but also working with local governments and the facilitators of action within those communities. So for example, after I leave this conference, I'm going to Portugal to work with the team in Lisbon, and then people from Portugal Ventures actually, and then off to Bilbao, Spain, where we're working with the Spanish government on a project around their ecosystem. And some people ask, like, what brings me to this? Because it's not my job, right? It's not my day job, but it's really my passion. My job is really as an investor. I started my career as an entrepreneur, helping build companies, helping have an impact by bringing technologies from university into the market, and then moving more into the investment space. So today I'm going to share with you some ideas around ecosystem development, and specifically in the area of medtech, but I'm also going to cover a couple of other topics, because this one topic alone could take days to discuss. So I'm going to try to keep it very high level and then open it up to questions that you might have. So first of all, which way should I aim this? Here? All right. So what I want to do is talk a little bit about Europe in general. All of my focus is really in Europe. I lived in London for a great number of years. I've been working in Spain and Portugal for over a decade. We're investing in places like Spain, Portugal, the UK, Ireland. And right now, my fund, Greybella Capital, is also entering the Baltics. Many of you might have met my business partner, Ruta, who is here. And the reason is because of the magic we're seeing. We're seeing this tremendous convergence of technology and innovation that's happening in this area, especially in the medical technology space, in the area of optics and lasers and other areas. So what we're seeing in Europe in general is exactly what I've written here, is that new technology centers are beginning to pop up, great creativity and innovation coming out of those. The universities are getting more sophisticated and more aggressive about teaching entrepreneurship, entrepreneurial-based programs. Years ago, it was scientists learned science and business people learned finance, and they may never talk to each other unless absolutely necessary. And now you're seeing this convergence where the scientists are saying, I want to take some business classes, and I want to learn about how do I get what I'm working on and what my lab is working on into the market. So that's very, very important. So you're seeing a lot of activity in the entrepreneurial sector, and one of the beauties of Europe that I love so much is that there's this non-dilutive funding coming from government. We don't have as much of this in the US, and I really think that the companies here are beginning to become more sophisticated in taking advantage of Horizon 2020 and many of the other programs that are beginning to seed the next generation of companies. And this is critical, because you don't want to take investment money from investors too early. You want to take it at the right time. And this allows many of these companies to get to that proof of concept. So the models that I often recognize and follow, that you're most familiar with probably as well, in ecosystem development or in the success of a particular region, are groups like Singapore, Israel, Cambridge, Massachusetts, and also Cambridge in the UK. And Barcelona is finally coming into its own as well in the area of medical technologies and entrepreneurship. So to basically set the foundation for this short talk, it's really to say the right time is now. The right things are happening in Europe. The universities are positioned well. There's a lot of wonderful things that are happening that position this region in a very unique way that allows you to really think about next generation growth. So part of that is funding. And you know, the funding component for startups is absolutely critical. And I think, as I talked about the non-dilutive funding, that's important. But as you begin to grow your company, you're thinking about venture capital financing. And when it comes to ecosystem development, if you don't have this kind of funding, you really have a very difficult time of getting out of the starting gate. So there's great news coming from all parts of Europe. As you can see by this chart here, this is a fantastic example of how things are continuing to progress. You know, year by year, if you start to take a look at 2014, 15, 16, this is total venture capital dollars invested in European companies. So these are real numbers. There was 4.5 billion raised just in the first quarter of this year. And if that continues throughout the year, what you're looking at is probably about 18 billion annual for 2017, which makes this one of the biggest years ever for venture capital financing. So this could not have happened, as you see, years ago. The reason was there wasn't companies to invest in. There wasn't the innovation and the entrepreneurship that we're seeing nowadays. And there also wasn't many of the venture funds, did not exist. You know, we've had the opportunity since I've been here to meet with lots of different academic groups and entrepreneurs. That didn't exist 10 years ago, nor did it exist in Spain or Portugal. And you've got great opportunities here to capture capital and really use it efficiently, because the cost basis here is very, very good for labor. The talent is very high. And companies, you know, Lit Capital is probably one great example. There's a couple of others, Practica Capital, Baltic Capital, that are really having an impact. And those type of investments are going to change the economy of Europe, but very much change the economy of the Baltics. One thing to be aware of is where the money is being invested and when. So the money is primarily being invested in the areas of technology, and technology is very broad, so it covers a lot of different fields, including medtech. But what you're seeing very often, not to go through this chart in any great detail, is that a significant amount of funding is in the earliest stages of the company. So this is sort of the 100,000 euros to like 3 million euro range. Then there's a big gap. It's difficult for companies to raise that next 5, 7, 12 million dollars. And that's actually one of the areas where our fund is very focused, is to fill that gap, to be the local investor that keeps the company locally and actually fills that gap, working with the other investors that have already put money in, and then giving those companies introduction into the US market or Asia or other parts of Europe. So this is an area that I believe government, when we talk about ecosystem and the importance of it, government and the local industry can really play a big impact by being involved, engaging, and creating funds like that. And then, of course, later stage capital is always available. You know, when you have a big balance sheet and you've got profits, it's rather easy. As they say, everybody wants to lend you money when you don't need it. Baltic innovation has been tremendous. I mean, just as an example, I mean, all of you know this area is very strong in laser, optics. Even some of the companies that we've met with are using these technologies that are all coming out of the Baltic region. The strength in Lithuania in this area is just outstanding. And we're seeing that technology being applied not only in manufacturing, which it has for many, many years, but also in the area of space, medical, sensing technologies. One of the companies we met with right here at Kaunas University yesterday is using sensing technologies that can actually predict irregular blood flow in patients in order to ultimately determine if there is a possibility that they may have a heart condition. So an arrhythmia is what they're measuring. We're seeing other types of technology to investigate disease progression. One of the companies we met with also was looking at liver disease progression and being able to use not only imaging technology, but also very complex algorithms to determine not only the morphology of the liver, but also what is the progression of disease based on the movement of that liver. And these things are life-changing. I mean, these are the type of applications and technologies that will change the world, not just Lithuania, but change the world and impact patients. And of course, robotics is another big area. We talk about tumor-fighting immune cells. The whole area around personalized medicine, stem cell research, and others is growing and doing a lot of good in drug discovery right now. So let's talk about probably one of the most important things that I often speak on is how on earth do you get the great technologies that are happening and get them out of the lab into the market? And that's really the challenge. We often joke that much of the technology that's being worked on at universities will never see the light of day. And the reason is because there's not that connectivity between the academician and the researcher and the business community. And I think one of the many things Lithuania is doing really well is making that connection. So we met with licensing officers in Vilnius and also in Kaunas. We met with a whole team there from the entrepreneur sector and group. And what they're doing is making that connection. They're finding somebody doing something really cool in a lab down the hall who's probably not talking about it so much, and helping them think about commercial applications. So, I think of it as very simply, it's just a process, and not every company is the same, but in the medtech sector, it's really critical to understand everything is based on a foundation of R&D. Great research, great technologists, people working together to understand the landscape, understand the impact on patients. But once you get beyond this, that's when the business people come in, that's when the university licensing becomes very, very critical, and then also the market is then tested. So you're seeing the market by the prototype, looking at what kind of business model. Do we want to do something direct to the consumer, or do we have to go through clinicians? Can we do something online, like many of the healthcare IT apps and others that my colleagues spoke about before? All of these things create different ways to impact health and change. And of course, then you're getting into how do you get paid? How does the company grow and succeed? And that comes from funding, strategic partnerships, and ultimately growth and exit. So this to me is, when you think about building an ecosystem, whether it be here or anywhere, absolutely critical to understand where you are in this cycle and also what are you good at. So universities are really good at this. Industry and government is good at the funding part and getting it into the market, hopefully. So identifying where your strengths and weaknesses are, and then ultimately backfilling with talent to do that. So herein lies the challenge that I see in Lithuania and also in other parts of Europe, is this funding gap. Because companies like the ones we just saw, they're basically being supported by academics, I should say, institutes, government, perhaps some industry partnerships. Very important groups like J&J are partnering to identify the very best technology that's out there and also supporting those companies. Not only can they support them financially, but very importantly, they can support them by giving them access to intelligence into other markets and also into some of the thought leaders. So raising that first sort of, as I say here, 1 to 3 million is relatively easy for most companies that have good people behind it. But then there's this funding gap. So as I talk to people about developing their ecosystem, I often encourage them to think about, fill that gap. If you can't fill this gap, what will happen? Well, 2 things will happen. One is that these great companies that you're beginning to develop could go out of business, or maybe they're forced to change their business model to be kind of a service company, which has very little scale, right, in comparison to a product or a drug company, or they leave. They go someplace else. So they pick up and they go to London, and that's where they raise their 5 million or their 7 million, or they pick up and try to go to the US, and people think money is like falling off the trees in the US. I can assure you it's not. It still takes 6-9 months for a good company to raise money there. And The problem there is getting above the noise. There's so many companies, and it's chasing after all of the same dollars. So as an ecosystem, as a government, as a community of entrepreneurs and leaders, think about how to fill this gap and how to maintain the jobs here, which drives the innovation and the future technologies. So just to sum things up, I really believe that this region has an opportunity to lead the world, especially in the area of medtech. This is a very, very unique area with very good educational institutions. Entrepreneurship is being developed. You've got complex technologies being developed here all of the time. And being able to create that next generation of entrepreneurs and great companies and have impact. And it all starts with the people. And I think that if you think about sort of a entrepreneurial ecosystem as sort of phase one, how do you do this? And very often, I'll be sitting later this week with a group from the Spanish government, and they always ask, what do we have to do first? You know, should we build a building? You know, governments love to build buildings. We have an innovation center. And you say, no, it's not anything to do with the building. It's the people in the building that matter. So it doesn't matter whether they're working in the basement of a university, and you call that an innovation center, whether they're working out of some rented space somewhere. It's not the infrastructure as much as it is the people. And if you don't have the people locally, import the people. Bring them here. I mean, you have a beautiful, beautiful region. There is lots of entrepreneurs that have been very successful that live in Spain or in London or in the US. They would love to be more involved with companies here, join the boards of these companies, help advise them, and help create that ecosystem. And then, of course, around that, you've got entrepreneurial education, and innovation drives that very, very much. You know, I think it was Peter Drucker that said, innovation is really the instrument of change. And that is so true. You're not going to develop future technologies without innovating the existing technologies. And then phase two is really to think big. When I think about how does a whole ecosystem, whether it be medtech or tech or, you know, you could pretty much pick any industry. If you're in the fashion industry, it's exactly the same. How do you build an industry? The project I did in Singapore, which was with Temasek, which is sort of the governmental funding agency that has a series of other groups called Bio1, they started with buildings, but before they did the buildings, they had the people. And then what they did is they reached out to industry. So they created this phenomenal area called Biopolis. And if you Google it, it's super cool. Look up Biopolis, just like it sounds, B-I-O-P-O-L-I-S. Biopolis is a series of incredibly interconnected buildings. And because Singapore is perpetually hot and humid, they're not only connected by skywalks, but all of the garages connect to all of these buildings. And you walk through there, and state-of-the-art facilities. You've got Novartis has their tropical disease group there. You've got some of the world's biggest pharma. But they've imported people. Now, Singapore's a small island nation, right? They're not rich in natural resources. They're rich in talent, but they can't build enough talent, right? I mean, they do incentivize people to have babies, believe it or not. They actually do. But the problem, of course, is that they don't have the experience management. So what they've been doing is importing that talent, bringing people into their universities to guest lecture, bringing people in on boards. So they're a good example. So research institutes and incubators are part of any ecosystem. Academic institutions, without that, I actually don't know of an ecosystem that's ever developed without really this, the academic institutions. Creating an entrepreneurial culture, probably one of the biggest pieces of that component is giving people permission to fail. Let the entrepreneurs fail. They're going to learn from it and then fund them and do it again. In the US, it's almost like a badge of honor. You talk to some people that are, you know, they're in their 30s or their 40s, and they've already done 3 companies. And one might have been a complete disaster. And it does not make them untouchable. It actually makes them more hireable because they understand the difficulties of raising capital and hiring and firing and costs and et cetera. The government sector, such as the defense industry, become incredibly important. I know in Israel, which is probably one of the most vibrant ecosystems, much of the great technology coming out of Israel was founded based on technology being developed at the governmental level. So imaging technologies and others. And of course, creative young people. That is absolutely the key, getting young people to engage. So instead of getting them to think about, you know, go to work for a big company right away, get them to think about how do you actually engage with startup companies or work with companies like J&J or others that are spinning companies out or creating companies. And then there's a few others, having a supportive government, is critical. Logical employment laws, funding support, bringing experienced entrepreneurs in if you don't have them, and then of course corporate R&D. You've got great companies here. One of my colleagues showed a slide before. I mean, you've got world-class groups and companies here. Many of them are looking to figure out ways to better tap into that culture, and many of these young people want to do something more entrepreneurial. So I'm going to pause there, just stop for any questions that you might have, and I hope you found a little bit of this informative. Thank you.
Are there any questions?
No. All right.
I have a quick
please.
question. I got the impression from you that the gap in innovations between US and Europe over the last years is getting narrower. Is it what you see?
Without a question, yeah. I mean, I think even over the past probably 7 years, there's been a change, but over the past 3 to 4 years, there's been a significant impact. I think part of it was driven by the economics that were happening at the time. You know, Spain and many other countries suffered a significant crisis. And what you saw is people weren't able to rely on, you know, getting out of university and going to work for Telefonica or to work for the government or something there. They said, wait a minute, I'm going to do something on my own, and I'm going to do it with my 3 buddies that I went to school with. So out of that created more entrepreneurship, which also innovation was fostered very much in that way. I'll add one more thing that I think is very unique that's happening globally that wasn't happening years ago. And the word I use is convergence. You know, years ago, you go to a university, you have the chemistry department, you have the biology department, you have the engineering department. They never talk to each other. They don't even attend the same conferences, right? I mean, they're different industry sectors. Now you're seeing great universities converging where you're seeing more and more interplay between those different factions, and that creates tremendous innovation. At MIT, for example, we have a group there you can look up called the MIT Koch Institute for Integrated Cancer Research. And in this one building, it's K-O-C-H, Koch. In this one building, we have polymer scientists, nanomaterial experts, electrical engineers, mechanical engineers. It's absolutely outstanding. So imagine when you put that sort of group together, innovation is created. And I'm seeing that in Europe more and more. Right. Question?
Yes. Could you tell us a little more about your fund and what your investment profile looks like?
Sure. Thank you for asking. So the fund is focused primarily in medical technologies, diagnostics, healthcare IT as well. We also have a tech piece of it, so we're also investing in complex technology, big data analytics, AI. The fund is really designed as a Series A, Series B fund. So what that means, sort of in simple terms, is we're not the first money in. So we're not doing seed. There's great companies here, by the way. I mean, Lit Capital is a good example, and others that are doing phenomenal work, seeding these companies and really hands-on management. So we would then come in and partner with those VCs and apply about 3 million to probably 7 million euros per company over the life of the company. It might go in at one tranche, or we may put 3 or 4 million in, and then we hold a little bit back for the next financing. So that's part of it. Geography would be all the Baltics for this part of the fund. And then in other parts of Europe, we're really focused in Spain, Portugal, the UK, and Ireland. And my partners are based primarily in Europe, and then also some of us are splitting our time in the US as well. One other important thing I think to point out is that the fund is not a financial investor as much as it is an active investor. So we lead or co-lead the financings. We sit on the boards. We work very closely with the entrepreneurs to build the company, introduce them to talent globally, introduce them to partners, whether it be in the US or Asia. So we don't just put money in and then hope it goes and grows. We actually really work with the companies. So I don't know. I hope that answered your question. A little bit? No? You have a follow-on or? And we are raising capital now. I should mention that as well. So we're currently in the process of raising that first part of that fund at this moment, and we're talking to a combination of institutional as well as family offices helping us with that. Go ahead.
Thanks, Richard. My name is Mindaugas Plieskis. I represent here global pharma company Johnson & Johnson.
Yep.
My question, thanks for brilliant snapshot. That was really great. My question is about the role of the government. Could you please elaborate a little bit more? What is the role of the government? How they could help and foster the ecosystem of innovation?
Yeah, so the role of the government, it is always a tricky thing to answer, especially when there's government people in the room. My opinion is that government should make things easy and then get out of the way. And I mean that in the best way, and I think that's what they want to do, right? An overly regulated environment is an environment where you can't move. So what can government do? Government can provide funding. Government can provide laws and regulations that streamline things. So for an example, in the United States, I can literally decide today, I'm going to start a new company. I can go online, I can register my new company name with online. Delaware seems to be the main area where people choose. You know, you have to pick a state. Whether you're there or not, Delaware has very sophisticated laws. I can literally start a US Delaware company today in 15 minutes online, and I'm incorporated. At that point, I can literally manage all of the other components that I need to deal with the government online. So what's government interaction? Well, thankfully not a lot, because they paved the way. So I think government's main role is to create laws, regulations, and procedures that make it easy to bring innovation to the market. And that involves funding, that involves patenting. Another area that I often get in trouble talking about is employment law. One of the reasons France suffers and struggles to build an entrepreneurial ecosystem is because their employment laws are a disaster. I wouldn't start a company in France today if literally they gave me all the money to start the company. They have idiotic employment laws, and that kills startups. It absolutely kills them. How can I hire somebody and I have no way of firing them? And if I do fire them, I have to pay them for a year. It's just completely mind-boggling. And it could be a combination of the company needed to downsize, or it could be that the person is just totally incompetent and wasn't right for the role to begin with. So I will say that is another example where employment law is just something simple. People can't change employment laws, government can. So how easy is it for me to hire people, to bring people in? And also another component is bankruptcy. Bankruptcy laws have to be in place in order for companies to be able to successfully renegotiate with creditors if they're in a bad position, and for people to have a clean slate and start fresh. And that's something in the US, nobody wants to go down that path, but if a company does, you certainly want to have laws in place that support that and don't destroy the entrepreneurs and the shareholders. So it's a much longer discussion, but I'm glad you asked. Government plays a very important role, especially in the beginning of creating an ecosystem. Yep.
Hi, my name is Erica from
Erica.
Baltic. I wanted to ask, maybe you could share some success stories of companies in this particular area which you helped growing or...
So how are we for time? I want to be respectful of the next speaker. And yeah. Right. So, well, first of all, we're just entering the Baltics area now. So I can't give you any case studies of companies that we've actually, in my opinion, contributed to in any way. We're meeting the companies, we're meeting the important investors who will be our partners in investing in the companies. I will say we've met some amazing companies. One of them that we just had so much fun with was a company called Deeper. With absolutely some of the coolest technology, the location-based technology. They have one that's for fishing. They have another one that's this cool bike lock. And that's not an area we do a lot of investing in, but smart people, incredibly compelling technology, and an ability to have a big impact. So I think that there's great companies being developed. We haven't had an impact, I don't think, on any of them here. But certainly there's some great case studies in Spain and Portugal and elsewhere. And you can even look at our site, and there's some information there as well. Hopefully next time I see you, I'll have a good case study for a Lithuanian company we've supported and launched. Maybe one more question? Any others? All right, you guys have been wonderful. Thank you so much for being so engaged.
Thank you very much.
Thank you.
We'll move on, and our next presenter today here is Yanis Yatnieks.
Thank you so
who
much.
comes from
Very
Latvia.
kind. Thank you.
Has been involved in 3D printing business over the last years, and recently he started a project-wide which aims to create next generation prostheses. I've seen them on YouTube. I'm really looking forward to his talk where he'll talk about how technology empower personal health care these days. So Yanis, please.
Hello, everyone. Can you hear me well? Very good. As I was already announced, my name is Giannis, and I'm here to talk about a rather broad topic, which is technology-empowered personal healthcare. If you would look at my CV, I would probably not be qualified to talk about this. That's why I'll be talking about concepts that we have either already implemented in our company or we're planning to implement in the near future. So anyway, how you look at it, either we've done it already or we'll do it very soon. And therefore, it's more or less our personal experience that I'll be sharing today. I come from a background of 3D printing. So we started about 4 years ago, and our office is essentially a 3D printing center. We are one of the largest in Northern Europe, and we were able to do anything starting from an iPhone case to a complicated model for medical education and even airplane parts. And about 3 years ago, a lady came into our office together with her son, Richards, and she was asking us to 3D print her son a prosthetic hand. We thought, knowing that we can do all of those other things, this should be a fairly simple task. But we can be more wrong. Richards doesn't have any fingers on his right palm. And he wanted the prosthetic that he had seen online in YouTube videos. And it's a simple prosthetic that uses hand movements. It's mechanical. So those people who use it don't have any fingers. But once they bend their wrist, the hand closes up, bringing back some of the motor function to the hand that they didn't have when they were born. When we started out helping Richards, we found these designs online, and we used a simple scaling function, which means it's like zoom in, zoom out function for 3D models, and we 3D printed them. These are number 2 and number 3, because number 1 we made for the wrong hand. So that is how experienced we were in the field. And when the little boy came in, we were so ashamed because we couldn't really provide a hand that would function for him. He could wear it like this, but it didn't really give him the functionality that he was looking for. And it was embarrassing. I mean, we could do all of this 3D modeling and printing and so on, but it didn't really work here. So what we did, we actually set out to find somebody who can help us in the process. And we found a young guy that was a prosthetic specialist, actually studying to become a prosthetic specialist. And he also became our co-founder. And he started learning 3D modeling from scratch. We had some 3D modeling engineers that could help him, but I mean, this is a field where we're talking about human beings. You need some basic understanding and so on. And in about 2 weeks, we had something to give back to Richards. During those 2 weeks, what we did, we used the measurements we took off the hand or off the limb. Then we did the 3D modeling, which was actually the biggest portion of all of it. I mean, we went forward and back all the time to come to this customized design. Because why the first hands didn't fit Richards was that they were not custom fitted. Every single medical device that is currently made for persons to use is made by a specialist who custom fits it. So it's a very, very individual thing that you wear. We tried to do it digitally, and that was challenging. And obviously, after all of that process, we 3D printed it. Seeing for the first time when the Richards was wearing the hand, it was really when we started looking into the field, because we understood this is a way how we can help more than only Richards. And that brought our attention to the fact that we wanted to know how many people do really need these sort of prosthetics. These exact hand prosthetics. So there are about 177 people born with upper limb deficiencies, which means that they could be using some sort of prosthetic hand that is 3D printed. It comes down to 65,000 cases a year. Imagine if we try to help each and every one of these patients, multiplied by 2 weeks, and you understand that we can't really do it. I mean, it's not an efficient way to do it. And we started looking into how many other products could be made with a 3D printer. Not only talking about prosthetics, but anything else. So we found out that from the 110 million people who need prosthetics, orthotics, and other assistive devices, as we call them, only 36% will get them, which means more than 70 million this year will not get what they need. The picture is even worse if you look into the statistics of growth, for example. Maybe if the market grows fast enough, maybe even the supply grows fast enough, then this could be solved that way, but the industry is not going to grow any faster than 5% for the next 10 years. And that kind of solved the problem of us lacking almost 2 times the number that is made right now. Also, the educational system is not in place to solve the problem. For example, United States, 15 universities, they produce at around 350 students a year that become prosthetic and orthotic specialists. But to make 70 million devices, we need about 40,000 specialists. For example, Sweden does prepare about 15 specialists a year. And if I would assume that Lithuania is similar to Latvia, it means that you have about 5 to 10 specialists here, new specialists a year. And what they go through every single time when the patient walks in, they go through a very labor-intensive process of taking a cast of their limb and ending up with producing something by hand. So all hand tools, all very analog, and it takes many hours. So when we look back at what we did, we knew that we know 3D printing very well. We could do it, with our eyes closed. We can do some 3D modeling, and we had the first experience with Richards, but we were really, lacking the 3D, the measurement side, right? So if you want to make a digital process, if the measurement is not digital, then it doesn't really make sense. And you can make many human errors in the process if you try to do that, for example, making a prosthetic for the wrong hand. And that's why we looked into 3D scanning. And 3D scanning came into place to completely replace, measurements. So right now we could take, for the next patient, we took a 3D scan of his hand. So we have a digital copy of his hand. He doesn't have to come in anymore. He doesn't have to come for fittings because we can fit everything digitally. So what we did next is we prepared a 3D model for his hand of the same prosthetic that we made for Richards, but customized it. We basically took the scan and wrapped the prosthetic around it. And then, of course, again, 3D printing, which is, very, very easy for us. But if we want to do the same approach for every single person they need, and to get them to the 3D printer, the big unknown yet is who's going to make all the 3D models necessary. Right now, a professional 3D designer can make a model of prosthetic or orthotic in about 2 to 4 hours. That is a period that means they take the 3D scan, they manipulate the design of the prosthetic, and outcomes is something that usually needs conversion to be 3D printed. So that's a fairly long process. Most digital specialists, most 3D designers, they receive quite high hourly rates. I mean, some of them, can be as expensive as lawyers, maybe just working a bit more. But the point being that this has become either really, really long or either really, really expensive, and it's not sustainable. So if we take the 3D scan, and now even my phone can do a 3D scan of a limb. It's not very accurate, but I mean, with time, it's going to be better and better. And if we know 3D printing, the only thing we can improve is the middle part, the 3D modeling, everything connected to what the professional 3D designer does. And that's where we came in with our company. So when we established, we started looking into what can we automate, what can we make quicker, what can we completely remove from the equation. Because most of those software solutions that are currently out there, they're made for engineering airplanes, they're made for engineering buildings and so on, and therefore they're complicated in a very essence, they're not made for making parts for humans. And if you just quantify this, 2 to 4 hours for a single designer would mean that he can help up to 4 persons a day. 80 persons a month or about 1,000 persons a year if he was really, really efficient. And even just tackling the problem of the upper limb deficiencies where you don't have fingers would take 65 specialists with a really high payroll. And we didn't really want it to go that way. But what we did, we created a new software that completely removes the middle part. And the software is based on very simple logic. When we have the 3D scan come in, it looks something like that. This is actually made on a mobile phone. It's very simplistic. You don't see separate fingers. You don't see anything unnecessary. But the overall anatomy of the leg is completely enough to make a brace like this. This is also one of the things that we can currently make in about 3 minutes. And that's what the technology brings to us right now. It opens up a way how to keep this real, the process of 3D printing medical assistive devices real quick. 3 minutes is about 15 times faster than anything else on the market right now. And we can save valuable time for the specialist to focus on other things. Because if you really wanted to go into this, I would need 1 to 2 hours to teach all of you how to use our software. And you don't need any medical background or any 3D modeling experience to do that. And why we did it is because we still need the medical professional to be doing this manipulation. And medical professionals, believe it or not, they don't have 3D modeling experience most of the time. And that means that when we walk in their office and we tell them, how 3D printing is going to help them, they don't believe us the first time. When we tell them that they're going to be using a software solution to get to that result, they don't believe us the second time. So it's a process of us being able to be very easy to use with the software solution that we provide to them, and currently we are. This hand, this is the number 3 that we made for Richards. The blue Batman hand was made in less than 10 minutes by a person who doesn't know a clue about 3D modeling or prosthetics. I'm not saying that we want to give this to the masses and now everybody is going to be creating prosthetics, even though it could be maybe done in developing countries where they have no specialists available. But this brings the possibility for any specialist to start working on digital manipulations. So what we're proposing actually is, in a sense, imagine a scenario where a patient walks in the door in a prosthetic specialist office in Australia. And it's very, very close to the end of the day. They take the 3D scan. It takes about 2 to 5 minutes, usually 10 minutes, because unfortunately you need to speak to the person who walks in the door. And after the 10 minutes that you've done the scan, you can send it to a certified and credible source, let's say in Kaunas, a specialist that's sitting here, that's going to do the manipulation real quick and send it back to the specialist in Australia. The next morning, he walks into the office and he can launch a 3D print if it's not launched already. So it means we can decentralize all the processes that come in between the 3D scan, the software, and the printing. Because printing now can be done anywhere. There are printers in Kaunas, there are printers in Vilnius, there are printers in Riga, almost everywhere. So that printer problem is not a problem anymore. It's just a question of availability. Also, the 3D scan, if it can be done on the mobile phone, that's not going to be a problem anymore. So what really is important is that we can find those free specialists and we can provide them with a reliable software solution that they can use to process all the data in the world. So imagine if there are 2.something million mobile devices out there. I don't think it should be a big problem to make 70 million scans. The problem would be how to process them now. So in our minds, what we're doing right now back in Riga, trying to battle this problem and thinking of ways how we can make a credible network for specialists from Australia to believe that the Kaunas doctor is going to do exactly what they wanted to do, is making something similar to an Airbnb for medical specialists, or rather Uber for patients who need prosthetics. And this is where we're going to, and hopefully a very reliable blockchain solution is going to help us in the near future to achieve this quite quick. Thank you very much. I guess I'm open for questions, so it was a pleasure. Yes, please.
Hello, my name is Fury, just recent graduate from Manchester. I've been doing civil engineering. Have a question related to producing different parts by 3D printing. So let's imagine we have a phone case and prosthetics, and it's quite straightforward how to produce like a phone case. But what are the regulations in order to produce the prosthetics? Thank you.
That's a good question. Number one, we're dealing with a very uninformed industry and uninformed public. So people generally don't know what are the differences between 3D printers. When we talk about 3D printing prosthetics right now, we're only talking about industrial machines. So we're talking about reliable materials. We're talking about reliable machines that have 100% success rate in their outputs. Most of the small 3D printers that you see around would not probably be able to do it because they're not at that development stage yet. In the future, potentially, any small 3D printer could be making a medical device with a specific material that can, be interacting with the skin and all that. Right now, we print from specific materials. In this case, it's nylon 12. It's an industrial grade material, and obviously, the machine that makes it is reliable. So the quality of the part is there, the integrity is there. But who signs off on the device is the specialist itself. And that's why we need a specialist in the equation. We cannot carve out the professionals who have spent years and years in their education because they're the ones signing off that this device is going to do exactly the same thing that device that they make by hand. And they're the ones signing off. So this is currently how we do it. It's also in Latvia.
Are there any more questions? If not, then I want to thank Yanis for his inspiring talk once again. Thank you.
Okay. Thank you very much.
Now it's my pleasure to invite the next speaker, Justina Januševičienė. Masevici has been holding very important positions in Ministry of Health in Lithuania over the last 5 years and has been dealing with many complex issues also related to e-health system and ICT decisions. So I don't think there is another person who knows better how modern medical technologies are being used in Lithuania, and we are very much looking forward to your speech. Justina, please.
Well, thank you very much. Good afternoon, everyone. First of all, I would like to thank you all and the organizers of this wonderful conference for having me here, for giving me an opportunity to share my insights, to give a short background overview on how we're doing with healthcare technologies here in Lithuania, and how did healthcare technologies impacted our healthcare system, its capabilities and needs. Well, first of all, as we refer to healthcare technologies, we have to understand what we mean. Well, we can find many definitions on healthcare technologies depending on source, from very precise ones limiting themselves with vaccines, medicines, procedures, medical devices, to very broad ones covering multiple aspects. I like the one which is given by World Health Organization and says that it's application of organized knowledge and skills concerning vaccines, medicines, procedures, and systems developed to solve a health problem and improve quality of life. This means that any technological product or a management solution which gives relevant contribution to healthcare may be referred to as a healthcare technology. And well, healthcare technologies are moving very fast. From concepts, prototypes, from clinical trials to clinical and daily practice. And it's even more so because technologies tend to accelerate one another. While healthcare management headways are based on long-term strategic documents, we have dozens of new innovations and technologies being introduced every day. So we have to be ready though it's very hard to be ready for technologies pouring into our daily lives and changing the things we thought we knew everything of. So how did technologies change our healthcare system? Well, we should not underestimate the power of internet. It definitely goes without saying that more and more people are researching their medical issues on the internet at a daily basis. And it's not about looking up for symptoms. It's also discovering new methods, treatments, vaccines, and healthcare providers. Well, definitely the internet makes a patient more empowered. While it's never a good an issue to skip our doctor's consultation, absolutely, but patients are aware what to do next, how to live with their medical issues. It gives some new flavor for a doctor and patient relationship. Well, on the other hand, most of the healthcare sites are not certified by any healthcare authority. They cannot be controlled because of the extraterritorial reach of the internet. So the risks of getting false information still exist. So internet heals, internet might hurt. So it's a very important issue for policymakers, for patients, and for healthcare providers as well. Well, continuing with the benefits of the internet, we should mention the impact of the social media. On a daily basis, more and more healthcare providers are trying to establish contact with their patients on social media. They're trying to perform community outreach. They're trying to raise public awareness campaigns. They're trying to answer questions concerning procedures and methods applied in healthcare providers' facilities. And it's very popular in the US, and now it's coming to Lithuania. Well, some sophisticated sites even offer instant chats with nurses and doctors concerning some clinical issues. And well, additionally, social media used for quality assurance purposes, as healthcare providers give some space for patients to express their opinion and their impressions on healthcare providers' facilities, on services provided, on doctors, and giving some positive or negative feedback. So not surprisingly, about 60% of Lithuania's healthcare providers are on Facebook, and half of them are actually contacting their patients and communicating with them. It's an amazing impact of social media. Well, I think we should not skip and should not forget the most obvious way that technologies have changed our healthcare by introducing new medicines, new machines, new methods of treatment. And it's not only healing billions of people, of patients directly. It's about having a space for new quality research, for inventing new methods, for having better innovations. And Lithuania's aim by 2020 is to facilitate access to healthcare innovation. So the main emphasis is put on oncology, on cardiovascular diseases, on rare children's diseases, and healthy aging. Well, definitely technologies empowered us to cooperate and network. Well, as one of the most successful examples of networking, I would name European Reference Networks. It's the most successful initiative which has ever happened in the European Union at cross-border level. European Reference Networks are meant to facilitate innovative treatment methods, research and cooperation, and highly specialized healthcare in rare diseases. So Lithuania, as a small country with several millions of residents, show that it's capable of providing sustainable and highly specialized healthcare. And so our two university hospitals currently are participating in 12 thematic rare diseases area out of 24. So it's an amazing result. Well, definitely technologies gave a positive impact on clinical and translational research. Every year, we launch more than 100 clinical research concerning medicines and more than 10 biomedical researches concerning inventing innovative methods and diagnostics treatments. Well, which is very important part of our healthcare system is deploying our scarce financial and human resources wisely. So that's why health technology assessment plays very important role. we introduced HTA in 2012. We started with medical devices. Afterwards, a year later, we switched to public health technologies, and now we're working hard to prepare experts who will be capable of evaluating health medicines, innovative medicines. So with the help of HTA, we managed to introduce 20 innovative healthcare technologies to reimbursement. And we presume that this definitely help us to save and to allocate our money wisely. IT, as was previously mentioned in the previous presentations, made our healthcare safer, made our patients more empowered and more aware of their healthcare issues. While there are very few countries across Europe which grant full access for the patients to their EHRs, to their medical files, Lithuania is one of them. Our patients have to have an opportunity to review their EHRs, their digital images, and e-prescriptions. Lithuanian e-health system is combined of a central platform, which consists of EHR, the central part, of two subsystems of e-prescription and digital images. And the other important parts are hospital information systems, classifiers, and registries, which are vital for functioning of whole e-health system. The access to the system are granted in two ways. The first one, which is 100% accessible and requires no additional software, is the portal. So all you have to have is a internet connection, a browser, and a tool for identifying yourself. It might be e-signature or e-banking account. And this way is mostly used for patients to review their medical files, and it's also used by small healthcare establishments, which are too small to have their own hospital information systems, and they use this portal as a virtual hospital information system. It fully completes their expectations and needs. And the second way is direct and interoperable integration between healthcare establishment and a central platform. So this way is mostly suitable for big outpatient clinics and major hospitals. Well, this is the list of documents which is stored in the central system. So these are the main clinical documents as hospital discharge summary, patient visit summary, images, prescriptions, lab tests, and etc. And we also have certificates, the main certificates which are issued in our healthcare, at our healthcare providers. So I would say that birth certificates and death certificates, unfortunately, are the most popular e-services which are now deployed in Lithuania. We have 100% of the certificates digital. So I think that's a great performance result. And though some healthcare providers in Lithuania use electronic systems 20 years already, the possibility to exchange data was established not so long ago. We started the legal and technical background and in the solutions of interoperability in 2010. The 2013 was meant for entering into contract with vendors. The 2015 was a date for launching the production environment, for starting our system, for starting exchanging data. By 2018, in March, we expect all healthcare establishments to be using e-health system. And by 2020, there is ambition to be paperless. So though Lithuania has really positive ICT background and high usability of e-services, the beginning of a system was not that easy because of many factors: literacy, unwillingness, technical solutions. But now, after nearly 2 years of operation, the volume of a system is growing in exponential trends. The capacity building. It's needless to say that technologies has shifted our education training. It changed the outlook towards the possibilities to have a good and qualitative continuous professional development. So many doctors are saving time and having remote learning. We have a possibility to network, as was previously mentioned, like the example of European reference networks. So we can exchange knowledge, and we do not have to force our patients to travel physically. We can pool highly specialized expertise without leaving our facilities. And we have tools such as telementoring, which definitely help us to fight brain drain and the fear of professional isolation, which we all know that many young doctors, young professionals are really reluctant to get themselves employed in rural areas because of fearing of not having second opinion, because of fear to be isolated, because of fear of to be left alone with no professional growth. So all the technological solutions helps to fight them all. And the fifth, but not the least, we were talking a lot about big data today. And big data is a phenomena which is living among us on a daily basis. The amount of data is growing every day. Data has become a modern currency, which we use for obtaining services. So needless to say that European Union has focused big investments and bigger ambitions by 2020 to research and development, which means that a great share of funding will be allocated to analyzing data. And data is a main facilitator of innovations. So definitely, as was mentioned today, we have enormous amounts of data being collected. We have capabilities, we have willingness, we have to improve our infrastructure, and it's time to act and step forward. So thank you very much for your patience. I definitely can imagine that it's quite hard to take me as a last obstacle to have a coffee break for you. Thank you very much.
Stina, thank you. We are running a little bit late into the coffee break, but if you have a burning question, please. If not, then we can have some coffee and some refreshments. So please. And we'll restart in 15 minutes again.
Gerai, dėkui.
Try to get everyone.
Yeah, sure, gathering.
Okay, I think we can start. So we have the last speech today, which will be delivered by Simonas Drungilas. He's a vice president for operations at the company named Sermo, and he's been working with the company since 2003. And today he will talk really about a very important topic entitled "Growing Influence of Digitalization and Empowered Healthcare Practitioners." So, Simonas, please.
Thank you. Welcome, everyone. I want to thank Invest Lithuania for opportunity to be here and to address you. Thank you. It's a great opportunity for us. It's a bit, I feel a little bit slight pressure after hearing other colleagues, speakers today. I'm excited to hear and to see where the entire healthcare is going. And today, I'm going to be speaking on how technology helps doctors, how technology makes the lives of doctors easier. It's a bit, I feel that it is a bit unfair that we are doing the presentation because it connects with what we do so much. It's very close to us. It's like our, commercial or marketing opportunity for us. So I am aware that many of you are not familiar what is Sermo, except the few people that I talked today and yesterday and introduced our company. So I feel a responsibility to introduce what we are doing, who we are, and then focus to something which I think will be more interesting for you from the perspective what we have learned as a social network. So I quickly already mentioned you who we are. So we are a global social network for doctors and doctors only. The name of Sermo for Latin means conversation, which is the essence of the social network. We were founded in 2005 by a frustrated doctor who had a challenging patient case and did not have needed colleagues by his side whom he could discuss and have a second opinion on in that specific patient case and help him to make the correct diagnosis. And this challenge of his became his motivation and a mission to create an environment where doctors would be able to freely communicate and exchange their experience and knowledge. 1 year later, Sermo for US only doctors was created. Later in 2012, two healthcare-focused companies, a market research data collection for healthcare, with the name of World One and Sermo, US social network for doctors, have merged into one, and that's where the global social network came from. Starting from 2012, this Sermo social network had a presence in just one country, just US, and had about 150,000 members. And 5 years later, today, we are in 150 countries, and we have a bit more than 800,000 doctors. By the end of the year, we are planning to be in the entire world and cover the rest of the world and and have slightly more than 1 million members, and then grow further from there. With this slide, I'm planning to stop and stop focusing on what is Sermo, who we are, and start focusing on the actual technology, how it helps, what we give, and our technology, what gives to the doctors, and how it helps for the doctors to make the medicine better. So, who is the doctor that use online tools such as social networks? From experience, we know when we talk to the companies, to other people, the overall perception that doctors are not very good technology users, and only the doctors of recent generations are good technology users, where our data shows that this perception is not entirely correct. It's wrong. Our average doctor user is the average doctor which you would perhaps think when you're going to a hospital. It's a man, of course, in his mid-40s, with a practice of about 15 or more years. There are some information on the slide of the gender breakdown and the specialty breakdown. But an important fact, an interesting fact, which I want to add, I don't have on this slide, more than 60% of doctors are logging into Sermo, to our social network, using mobile devices. So that's another fact showing that doctors are actually good and quite early actually adopters of various technological solutions. So now when we know that doctors are using technology, so the question is, what do they do online? For personal life, just like you and me, doctors, of course, are using the same things like we are: search engines, social networks, YouTube, Twitter. They have their own life. They have families, pets, and other stuff who they want to share with others, like, let's say, pictures or anything else. The question is, for professional life, what do they do online for their profession? And of course, they use technology. Usually, those technologies are tailored to their medical background. We, Sermo, are an example of social network, a professional social network, which is dedicated for doctors and only doctors, where they can freely connect with their peers, with their colleagues, exchange information, exchange their practices and other learnings, perhaps, on some areas. And perhaps you would ask how it is different from the real life, because you can see other colleagues as a doctor and discuss with them on what you need, perhaps to ask questions, take conferences, and so on and so on. The answer to that is that, as any technology, medical life in this case is much faster. The number of people that you can instantly access is much wider that you could physically access. And technology, in fact, gives other useful benefits such as flexibility, freedom of choice, and so on and so on. Interesting fact which we have observed from our experience. Doctors, believe it or not, they're quite paranoid to be online and be identified. And a group of doctors of our users before, a few years ago, they came to us and suggested the idea of giving them freedom of choice to be anonymous on our social network to each other. Of course, regardless of what they are choosing, to be anonymous or not, we know who the doctor is, if the doctor is really a doctor, and if their license is active. But they have this freedom of choice. And in fact, if you're interested, 90% of our doctors choose to be anonymous to each other. And this is just an example of what you can achieve with technology. And with this choice, what we have observed, the activity and the engagement of doctors have increased dramatically. And when they trust the environment, first of all, they know that they are among doctors and only doctors, and they know that they can be, in some cases, anonymous. They can post something or comment something and be anonymous, or on next post they can choose to be identified as well. Magical things have happened. And in this case, what you see, we provide an environment for the doctors which they trust and they freely engage. And this way, what we have, the exchange of information, the exchange of your experience happens much faster. The number of experience when doctors are joining into one discussion increases dramatically as well. And this is, as a technology, as an example, is just at the beginning. With the technology, actually, we can provide so much more things to doctors and to have their time spent much more efficient, much more focused on some things. Sorry, this slide I plan to skip and to remove, but it stayed here, so quickly on that. I happen to be a vice president of global operations from market research side, so we provide the ability to doctors to take service and to earn money. So that's again a technological solution where doctor, without leaving his office or without even seeing a patient, they can provide their experience to pharma company in this case, most probably, and well, by doing some good thing, earn some money as well. Interesting fact, I saw the slide and I remember I had some piece of information which is basically our research on how much time a regular doctor spends working a day. It's about 12 hours. And we have had it broken down into where they spend actually that time. Of course, majority of times being spent seeing patients. Then the second huge amount of time is spent on filling in the papers, electronic forms. And only up to about 1.5 hours they have time to do something online for their personal life. So companies like us and other companies that are providing some technological solutions, we compete for that 1.5 up to 1.5 hours. But imagine with a technology, if we could do something else, something else that could potentially save lives. Simple solution on online platform that could save perhaps lives. I'm sure you would agree with me that nobody can know everything in what they're doing, or at least a small amount of people could do that. And when we speak about the doctor, whose profession requires long studies, long practices, and it requires so much of knowledge, it is very, very difficult in some cases to correctly diagnose some patient if the symptoms, if the patient case is something that doctors have never seen before. Medical crowdsourcing. For me, from what CERMA is doing, this is one of the key things in how we, by providing a simple technology, a social network, and crowdsourcing, how simple technology helps really improve the medicine. What doctors can do here in this case, they can take a picture, write some symptoms of a patient case that they have, and post it to doctors, to other doctors to see and to comment. And imagine from more than 800,000 doctors, if anyone, how high chances are that some of the doctors from those 800 doctors saw a similar case in the past or similar symptoms and potentially know what's wrong with a specific patient. Chances are high. So in this case, what we see here, a technology able to help faster and more accurately to diagnose patients for doctors who not necessarily have experience on what they're seeing at the moment. As an example, this is one of the cases where we actually saw crowdsourcing helping the life of a patient. It is a case that happened in 2015. A doctor saw a teenage boy who had some symptoms similar to what you would think you would need to send that patient to a pulmonologist. But the mother had some weird stuff that the boy had coughed a few days ago. And she took that in a glass jar and showed it to the doctor. So what doctor did, so instead of prescribing some cough-relieving medicine and sending the patient home, what he did, he actually took the picture, described the case, and posted it on CERMA, on medical crowdsourcing. And then, of course, soon enough, the responses started coming in. And not a while ago, one doctor wrote to this case that he knows exactly the cases. This is plastic bronchitis. This is not pulmonology, this is cardiology. The boy needs to see cardiologist and most probably have few surgeries if the patient wants to live. And that is what happened. The boy saw cardiologist. He had, if I remember correctly, 2 surgeries, and the boy was most probably lives still today as well. But what important here to take from this slide, if you see at the slide, the doctor not only posted the case, but he also polled the doctors on what do they think the disease is. And out of 260 doctors, only 10% made it correctly. 10% made it correctly that this is plastic bronchitis. Other guesses, other diagnoses were not accurate and were not correct, which means 90% of cases, of chances of misdiagnosis. And if you see plastic bronchitis, it's quite rare case, quite rare disease, but if misdiagnosed, very often the ending is very fatal. Patient dies. So that's just an example of how, with the help of technology, doctors can come together, and if the technological solution, such as crowdsourcing, is focused on something very critical, such as patient cases, it helps. It simply helps not only improve the medicine, but in some cases help save the lives as well. Imagine another very critical aspect of medicine, drugs, medications. This is, well, very big industry. This is very critical thing to speak about. And imagine doctors, if they would have a tool where they can see how the medication, specific medication, is being rated by the doctors, other doctors. What we have on our social network is drug ratings, what we call drug ratings. It's a tool that doctors actually can do what I have just described. Rate a specific medication, a drug, on a specific indication on 5 dimensions. Simply provide their feedback, what they have experienced when prescribing that particular drug. It kind of looks very simple and easy, but from another side, it's very powerful. This idea, we say that this tool was created by the doctors for the doctors, and actually that's true. The idea of having such tool came by, was suggested by one of our doctors from the social network, Sarma social network, and the doctor said, well, is there a way to pull out an information from all the information you have, the comments, the text data about the drugs? Are there any specific adverse events? How well the drug is tolerated? And of course, if you would try to imagine how difficult it would be to aggregate such big amount of data that we have into something structurized, which you can use for your analysis, that would be difficult. What we did, we reached out to our doctors. We had a small poll of some doctors in some countries asking, who do you think has the best knowledge how the specific medication works? Do you think the information coming from the doctors will help you? And do you think, and would you change the way you prescribe the drugs? And of course, answers were, you can see here on illustrated on the slide. 69% said that, of course, those are doctors that has the best information on the drug, how the drug works. 74% said that it would be really helpful, and the high number of them said that they had in the past cases where they have changed what they have been prescribing. And interestingly enough, a lot of doctors were saying that they don't feel that they have full information about the specific drug when they are prescribing or seeing the pharma reps. And a high number of respondents of the doctors thought that they think that pharma marketing sometimes presents the drugs in more positive way than it actually is. In other words, doctors trust other doctors. And this source information coming from this technological solution simply helps to democratize the data, as we call this process. It helps them to have an alternative source of information for them when they are prescribing the specific drug on specific cases. And I don't have the information on how much exactly ratings we have, the data, in terms of that of the drug ratings. But as far as I remember, last time I checked, it was over 400,000 drug ratings in June or July, and it is constantly growing. The uptake of this technology for doctors is rapid, and it's constantly growing. You can see on the slide how this looks for the doctors. Pay attention that there are no commercial brands of any drugs. What we are trying to achieve and what we wanted to give to our doctors, simply a raw technological solution where they can rate the drug and review the drug that they are planning to prescribe to a specific patient, where it is on specific indication. Is it the first one? Is it the second one? What is the efficacy? What is the tolerability? And so on and so on. Of course, doctors can also leave here some text comment if they want, if they have something important to say on that. And my last slide is some statistical information. We already described what technology is being provided by us to our doctors, social network and a digital environment where they can freely connect and discuss with each other, and some few technological solutions for solving challenging patient cases and drug ratings. And only from the information of 2016, we see that we had more than 3 million unique sessions, tens of thousands conversations, and what I'm happy about, especially the number of challenging patient cases that were solved is more than 7,000, in which very simply had opportunity to take part doctors from 150 countries. So technological solutions are there for doctors. Technology really helps not only for us, for our life, to make it much faster and better, but for doctors as well in what they're doing. I am done with my presentation. If you have any questions, the floor is yours.
I just looked at it, and have you ever considered using artificial intelligence layer on top of the technology that you're making? Because it seems like just ripe to be applied there.
Thank you for your question. It's a very good question. In fact, we are using artificial intelligence or machine learning algorithms, but something, for us to help to aggregate the data, for us to help to structure the documents, for us to help to translate documents fast and efficiently. And the next step, what we're thinking, to do semi-automated programming, and for that we're going to be using the artificial intelligence a lot. But the answer is yes, but how? I don't think it's anywhere here on a social network that directly interacts with the doctor, but for us, for us to aggregate the data, but yes.
Thank you very much for extremely inspiring presentation. Well, for me, it's, how to say, I am proved that after your presentation, I am proved that social networks are valuable. Because up to now, I thought that, well, something like Facebook, it's just a thief of time, of my own time.
Thank you.
And now the question comes. I'm wondering if the Sermo network has some algorithm to avoid and to low rate some easy people, so, well, simply having slightly lower qualification on their comments.
Thank you for the question. It's a great question. One, I'm not sure I followed your question, but I will try to answer in two ways. So one thing is we are sure that only doctors are members of our community, no other people except doctors, and few people like me and a few others that can review social network on very high level for commercial purposes, for development purposes. But others, except some people from our company, nobody else is not the doctor. Everyone is doctor. We have very solid verification processes where we ask for a board certificate. Let's say it's the example of US, we ask for the board certificate number. We check that with the AMA, and we make sure that not only the license, not only the doctor has the license, but that license is not expired. On the qualification level, is it a junior or not doctor? We don't check that, but we surely do not accept students or residents yet. So you have to be fully working doctor, and we know, of course, what is the practice of each doctor, how many years a doctor has in his practice. If I answered your question. Thank you.
I have just one last question from myself, and when I hear talks like this, myself being a physician, I get strange feelings inside here, because there's a feeling that in the long run we're going to steal a considerable amount of our work. Several weeks ago, Elon Musk tweeted that this artificial intelligence, and it's coming into the healthcare as well, will create a lot of social turbulences with people losing those classical jobs in the long run. Zuckerberg responded that this is a little bit too exaggerated. What's your perception? How fast this will be touching us and shaping the healthcare in the future?
Well, it's a very good question. Thank you for that. I don't think you will be able ever to replace a doctor. You know, would you give your health and life in some case to a machine? I would not, clearly. The artificial intelligence is there. In our case, it's used for different purposes. We're not replacing the work of doctors. What we do, we provide tools, technology to a doctor to make their life easier, meaning do the work faster, get information faster, and make the diagnosis more accurate. In this case, to give the extra information very valuable to our doctors. The question about if technology will replace the classical work, perhaps in some cases. We saw the Yannis doing presentation, which to me is very close. In some cases, reduce the number of the need for some specific specialists. Maybe that's the case, but that's a question. That's a very good question. No more questions? Thank you guys for your time. I know we're towards the end. I'm very glad I was not the last one. Sharunas will have this opportunity. Thank you guys, and if you will have any questions, I will be available here still after this interview.
Thank you. Thank you very much. Listen, we are approaching towards the very end of the conference, and for the closing speech, we're very happy to have here Šarūnas Narbutas with us. He's probably one of the most active young people in the healthcare policy making in Lithuania, and he has served as a president advisory for the last 3 years now. He's the chairman of the Council for Government Fund on Promotion of Public Health. So Šarūnas, please, we're looking forward to your talk.
Thank you, and thanks for listening still. The ones are still surviving, so we're nearly till the end of the day. And congratulations us all for surviving also with high-pitched noise. That's a brainwashing machine for you to love Lithuania once you're in here. So you see it's working, that you are still staying here. But actually, I think why it is a great time that we are still together and talking about this, because it's always great to meet like-minded people, the ones with the, shining eyes, wanting to push forward, questioning all of the technologies that's there. It's all about disruptive and making another leap forward. For us in Lithuania, we've been struggling in our little sandbox to jump up and say to the world that we're here, please pay attention, you know. We are ready, we are serious, we want to attract investment, we want to attract great talent pool, we want to retain our Lithuanian diaspora, to get them back to Lithuania to contribute. And it started in maybe just a bold, bold views or bold ideas after 2010. In 7 years, this is where we are, where sitting here in the room, I was very proud that discussions at this level are able to happen here in Kaunas. We don't need to go to London, New York, Boston, whatnot. We can have it here, and we can have those prominent figures come in and speak with us. But it's not just about creating hype. It is about making it a continuous circle. So we know Life Sciences Baltics is coming around the corner end of that year, so it will be a bigger reunion of not like close to 80 people in the room, but more around 2,000 and more. So it's definitely worth coming. But why I wanted to, just before concluding the day and saying that all of the presenters did great, we managed to really fast track to foreign speakers to explain them what we are doing in Lithuania, why we are not just talking show, but we do things. And what it was very useful for us to hear from those prominent speakers from global arena of what are megatrends, because we in Lithuania, we don't have that much exposure. We need to go there, Google, have a friend who we know, or fly away to these conferences. So it's very good to have all of that in less than 4 hours, right? We started after 1 p.m., it's not even 5 p.m., and we got all of that covered. But just to say that we are serious, not just to having a great event, but that we're serious in growing life sciences and medtech in Lithuania. So there's few background information. There's a huge pool of public funds waiting for all of you to pick them up. And why I'm telling that? The Ministry of Health has EU structural funds for 230 million. Smart specialization under Ministry of Economy has 270 million. He has €500 million waiting to be invested, EU funding, not even the government funding. And that all of that can be contributing to what we were speaking about today. What we are lacking still, we lack this entrepreneurship. We know the entrepreneurship in Lithuania is existing in the IT sectors. We know a few startups in fintech, etc. In life sciences, there are a few cases. They are very good cases, but we would say that it's already on building up. It's already on the pan, when we would know that the next year, or next time we meet, we will be having not 3, 5 examples of what we try to do here, but dozens of that. And I know that the people in the room has those ideas. We just didn't get to the point that they would know how to get the team, how to make a progress towards that, and then how to pitch in investors. So it is also what is interesting to me, and I'm a bit of global person. I travel to places, I've been in events, etc. But where I love our Lithuanian young generation is that we do not want to do something just for money. We want to create impact. And because we're living in a system which is now opening up, it wants to use these talents, with smart people out there. And the public sector actually needs the hydration and to put them up and use the smart people to fuel the economy. So the timing is right, but the smart people, they think they want to make a change, but yet don't know how. So these enabling type of initiatives, well, we know the switch, this is what's even for the younger generations before students is doing, that they would, going in universities, starting to be equipped, that they need to have this entrepreneurship spirit. And by speaking with the students in medical field, so training to be medical doctors, pharmacists, IT guys, economists, I hear them, all of them has ideas of what thing they can contribute to the world, like make a startup, etc., but they are not daring. So it took in UK environment way longer. In US it was easier just to dare to make an extra step forward and to say, I will be different, I will try to make a change myself. Now we see you are the young people in the room. I would next time encourage you to go front seats, not in the back. That's something in Lithuanian Metal, again, pushing us in the corner, as instead of going in and getting all of the attention that you want and you need. So it is all about connecting the dots. So ecosystem, remember the cycle that was shown by Richard Killer here, Kiver, sorry, that it had all these necessary points that we have. not just willingness to change, not just the academic centers, not the educational programs, but entrepreneurship spirit and passion. What now every investor here is talking is not just value for money. It's not just that you would be, smart people with their decent salaries and would do it for money. It is about that you want to drive this impact. You want to see it happen, and you want to also see that it's for the common good. It's not that, someone will reap profits and that ended up, being sold on Wall Street, etc. You want to change this. And what better field than not life sciences, not medtech, that you can see this, this change happening. So I believe that, these reunions, I would call it, because many people, you've known each other in small circles. Now you see the circle is getting bigger, and then, the circles will connect, and then it will be Life Sciences Baltics, and then where we'll see, maybe it will be, again, in BioConvention, that Lithuanians will be telling that we have 20 great initiatives that we are having investors now. So it is about time to really understand what we are good at and not undersell. I've been with helping and in all these talks with Invest Lithuania for, 5 years, something like that. And in those times when we were really good, after we started up, we were already very good public agency. Now we are just way better. And at that time, they were saying, we are very good at selling Lithuania, but politicians don't understand us. The citizens don't know what we're doing. The business is not trusting us. Now everyone is circling around Invest Lithuania because we are, again, our people who know the trends and who can pull the right people together. And by seeing that starting from shared service centers, from IT industry, all of that is nice. So many companies and countries are able to benefit from that, but it's also a short-term thing. That's, again, I'm not really benefiting maybe them in all of these aspects because I believe in life sciences and in medtech, because not every country can say I will be best in medtech or life sciences, because it takes a lot of infrastructure training and all of these pieces coming together. We have this. It takes 30 years to build such infrastructure. We may say that, we have most hospital beds. We may have a very inefficient, healthcare facilities network. All of that because Soviet Union times. And we are really seeing as the worst in EU. But look what? See the challenge as opportunity. That would also mean that until we get to the point where we need all of this ration, we can provide patients with the shortest waiting lists. We can provide patients with the attention of a doctor that he deserves and he cannot get in Western countries. So we can turn disadvantage to going to advantage. And this is just a change of perception. So it is also for us in Lithuania to not see that, our healthcare system is not perfect. No system in the world is. But to start seeing the advantages that we see and don't just take for granted. But the waiting times, healthcare facilities, the personal touch to be in the room with, the heads of universities, senior investor, top executives from the industry, brightest, future generation being active in the startup setting and whatever, junior doctors associations, student associations, patients organizations. We all come together and we speak about we have a challenge to solve, but we are there for the solution. So not a single stakeholder will be able to change it. We heard from all the speakers that it's not the IT guy, someone very smart to come up with this solution that will change the world. It is coming through cooperations with doctors, cooperations with patients, cooperations with industry, cooperations with government. So it is all about networking. Hierarchy is not a word for 21st century. Cooperation is such a word. So I urge you to return back to Lithuania, to stay in Lithuania if you are here, to build great ideas in here, and after we are finished, to enjoy the good weather that I think we have engineered in MedTech area just for us today, against all the odds. So thank you and see you again.
Sharunas, thank you. I think this was an excellent closing speech summarizing the whole essence of this event today. And on behalf of myself and on behalf of Invest Lithuania, I just want to thank you, all of you, once again, and especially I want to thank the speakers for their excellent presentations. I think that we have all benefited also at a personal level, but in the long run, I think Kaunas as a region, as well as Lithuania, will have immense benefits from this afternoon talks. So thank you, and have a good day, and enjoy the rest of your time here in Kaunas. kad viskas čia gerai.